away from the American people, all so they can give tax breaks to their billionaire donors. That's why they cut Medicaid and Medicare. And now hospitals across the country are on the brink of closing. It's why they chose to shut the government down rather than work with Democrats to reverse healthcare cuts and lower the cost of premiums. Republicans are waging a war on affordable healthcare, and it is the everyday American families who are losing. But it doesn't have to be this way. Democrats are fighting tooth and nail to reverse Republican cuts to Medicaid and Medicare. We are in the courts fighting back against Trump's attacks on cancer research and the National Institutes of Health. We are in our communities making the strongest case we can against Secretary Kennedy's vaccine disinformation campaign. And we are here in Congress demanding that Republicans return to Washington so we can negotiate a bipartisan deal to reopen the government and stop the healthcare premiums from doubling or tripling on American families. We are here. Republicans are on vacation. We want to lower costs. Republicans want to raise them. You deserve better. Let's watch this video.
Republicans are waging a war on your health care on every front. They're gutting Medicaid, cutting coverage from millions of working families. They're going after your Medicare, shredding the safety net to lower taxes for their billionaire friends. They're defunding Planned Parenthood, blocking care for women nationwide. Hospitals are closing, nearly 300 at risk across rural America. They're pushing vaccine conspiracy theories that will make all our children sicker. And they're gutting cancer research, shutting down the labs that deliver cures. From Medicare to medicine itself, this is a Republican war on healthcare. We have to fight back before it's too late.
Good afternoon, everyone. It's an honor and a privilege to be here with all of you. Let me thank our distinguished witnesses who we look forward to hearing from. Thank you for your presence. Thank you for your willingness to share your stories and perspectives and experiences as it relates to the Republican healthcare crisis and the impact that it is having on everyday Americans all across the country. I also want to thank our distinguished steering and policy co-chairs, Nanette Barragan, Debbie Wasserman Schultz, and Robin Kelly for convening this hearing, as well as to members of House Democratic leadership and members of the House Democratic Caucus who are present and on duty, fighting for the American people at the same time when Republicans remain on vacation after shutting the government down because of their unwillingness to address the healthcare crisis that they have created. House Democrats remain ready, willing, and able to sit down with our Republican colleagues anytime, any place, in order to reopen the government, to reach a spending agreement that actually meets the needs of the American people and improves their quality of life, and that addresses the Republican healthcare crisis. And make no mistake, it is a crisis that is impacting everyday Americans all across the country. It's an assault on the health care of working class Americans, of rural Americans, urban Americans, people in small town America, people in the heartland of America, and people in Black and brown communities all across America. Just this year, Republicans have enacted the largest cut to Medicaid in American history. 14 million people will lose their health insurance as a result. Hospitals, nursing homes, and community-based health centers are closing all across the country, including in rural America, because of what Republicans have done with their one big ugly bill. They've also set in motion a possible $536 billion cut to Medicare because of the steps that they've taken this year on a partisan basis. Unless Congress acts by the end of December. Republicans have refused to extend the Affordable Care Act tax credits. And as a result, this month, tens of millions of Americans all across the country are receiving notices from their health insurance companies, making it clear that their premiums, copays, and deductibles are about to skyrocket. In some cases, double, triple, or quadruple. Married couple, for instance, that makes less than $100,000 can barely get by, currently is on the Affordable Care Act and pays $8,000 a year. That's already too much. But because of the Republican refusal to extend the Affordable Care Act tax credits, their yearly expense could triple to $24,000 a year. They will lose their health care or go into medical bankruptcy. That is not acceptable here in the United States of America. And that is why House Democrats, partnering with Senate Democrats, are continuing to stand on the side of protecting the health care of working class Americans, middle class Americans, and everyday Americans all across the land. Thank you again to our witnesses for your presence here today.
Thank you, Mr. Leader. Thank you to our co-chairs for bringing us all together. And thank you to our witnesses for joining us here today. As glad as we are to have you here, we would much rather be on the floor voting to end this chaos. But look around. Look at what the Republicans have inflicted on the American people. Cuts to Medicare, cuts to Medicaid, cuts to the Affordable Care Act, cuts to children's health insurance, cuts to medical research. All of this to take that money and give it to the very wealthiest in the form of tax cuts. And then what? After they've done this, created this healthcare crisis, how do they respond to their own chaos? They shut down the government. And they're taking it quite literally because they're not even showing up to do their jobs. And they're saying, we can talk about all of this some other time. How about November? Why don't we talk about the end of November? Speaker Johnson had a quote. He said, we have an eternity to deal with healthcare. No, we don't. That's the point. They are making healthcare more expensive for everyone, but we have a particular urgency around the ACA. And let's spell out what they did. They took away the tax credits that help people pay for premiums. They chose to spend that money on permanent tax credits for billionaires. Then, when they took those away, insurance companies responded by raising premiums. And notices of those increased premiums are going out over the next days and weeks. And families are finding out at home in my district that their premiums are about to double. They are having to make impossible financial decisions right now. And let's go to Benton, Louisiana, right in the heart of Mike Johnson's district. A couple making $88,000 a year in Benton, right now they pay just under $7,500 a year for health insurance. That is not cheap. But now, while Mike Johnson has his members on vacation, keeping the government shut down for another week, that couple is finding out that their premiums are about to triple, that their premiums will go to more than $23,000 a year. Nobody can afford that. That is putting insurance out of reach for Americans. And that is what is happening right now in Mike Johnson's district. And it's happening to the people that he is paid to represent. And this is hurting everyone. Cancer survivors, small businesses, moms, kids, and the real kicker, 267,000 veterans will lose their insurance as these ACA premiums skyrocket. But instead of showing up for work, coming to the table, negotiating with us. They are now also spreading that pain to our current service members who are at risk of missing their paychecks and going unpaid for serving our country because the Republican Party cannot even get its act together to come and do what we do in every shutdown and agree that we pay our troops. Mike Johnson said that's a show vote. I can't imagine anything more disrespectful, but that's their response to this is that we're just not even going to show up, that we are done negotiating. We have made our bargain. It is a billionaire's first plan. So here's my plea to Republicans. If you're not going to come to Washington, walk across the street, go next door, talk to your neighbors, hear about the true anxiety they're feeling, hear about the betrayal they feel that Donald Trump told them he was going to lower costs on day one and has done nothing but make life harder and more expensive. Then get on the next flight to DC and come and work with us. Stop these premium hikes, get our troops paid, get government up and running. Enough is enough. But I am honored to introduce someone who always shows up and has spent her career fighting for the rights of every person for affordable, accessible, high quality healthcare. A proud alum of our Ways and Means staff and former administrator for the Center for Medicare and Medicaid Services, CMS. We are so proud to welcome back to the Hill, Chiquita Brooks LaSure. And Chiquita, the floor is yours. Thank you for joining us.
Well, thank you so much for the invitation. It is always a pleasure to be here with you. I have spent my career as a former administrator of CMS and as a health policy expert, really trying to make sure that we have a more accessible and affordable healthcare system. And I am deeply concerned about the impending healthcare crisis facing our nation. Earlier this summer, congressional Republicans passed their budget bill that cuts over $1 trillion from Medicaid and the Affordable Care Act marketplaces, the largest healthcare cut in our nation's history. This, along with other actions and inaction, puts 15 million people at risk of losing their healthcare coverage. The first effect will be sticking over 20 million Americans who receive coverage through healthcare.gov or state-based marketplaces with a bill that doubles their health insurance premiums next year. Marketplace premiums will skyrocket by hundreds to thousands of dollars. People could start to see this sticker shock starting on November 1st, which is in just a couple of days from now, when people go to sign up for their coverage for next year. I really want to take a moment to put this in the context of the average American. About 1 in 2 American workers, about 2 out of 3 American workers are unable to pay a $500 emergency expense. This means that for so many Americans, they are one bill away from being in a very difficult place. The impact of these premium tax credit cuts could mean that if your roof leaks, you can't pay for that and your health insurance. Or if your car gets flat tire, the car that you use to get to and from work, these are the costs that we are talking about for the average American of these premium increases. Someone who makes $35,000 a year, which is about $17 an hour, will see their premiums rise by nearly $1,600 when the tax credit ends. If they try to make up this difference, they would need to work the equivalent of 11.5 hours a day for 18 days straight. This does not account for their childcare, the gas, and the other expenses that would come so that they could increase their working hours if their employer allowed them to do so. Let us not also forget just how important the ACA is for our small businesses. Nearly half of adults who are in the marketplace who are employed by a small business, who are self-employed, or small business owners themselves rely on these tax credits. On average, in a family business run by a 60-year-old couple making $85,000 a year are looking at a premium increase on average of about $22,000 next year. We should be celebrating small businesses rather than placing excessive strain on them to afford health insurance. The enhanced tax credits not only made coverage more affordable for working middle-class Americans, it also in turn made the ACA market more stable and kept costs down for all enrollees. But I would be remiss not to mention the looming crisis facing millions of Americans and healthcare workers who rely on Medicaid. The budget law makes many changes to Medicaid that will have ripple effects that could push Medicaid enrollees, like children with disabilities, adults who are juggling multiple jobs, older Americans who rely on home and community-based services, but not just those people, but our healthcare system and our state budgets may be pushed to their breaking points. Although many of the Medicaid provisions in the bill do not take effect until around 2027, we have already begun to see the effect on our healthcare system, which will harm all of us. Over 300 rural hospitals are at risk of closing due to Medicaid cuts. In Georgia, a large hospital system announced just a couple of weeks ago that they were closing their labor and delivery unit due to the budget law. Rural clinics in Virginia and Nebraska have already announced their plans to close. We were already in a healthcare crisis in many ways. When I was CMS administrator, I would often hear stories across this country about the impact of rural closures on rural communities, from a widespread job loss due to the rural hospital being the community's larger employer to families having to drive further during an emergency. As a mother myself, I certainly understand the stress that you would think when you hear that your labor and delivery unit is closing. Nobody wants in this country a mother to have to deliver her baby on the side of a highway because she could not make it to the hospital on time. But that's the situation that we are facing in parts of our country. None of these things are inevitable, neither the shutdown nor higher healthcare costs. It is a choice that congressional Republicans and the Trump administration have made. They have created so much uncertainty in the healthcare system, uncertainty that will continue to cause more hospitals to close, insurers to raise premium costs, and people to choose to go without a health insurance. The American people should not have to choose between affording groceries or paying for health insurance. But if we continue this trajectory that congressional Republicans and the Trump administration have sent us down, that may very well be the choice that many individuals and families as early this fall will have to make. Thank you.
Thank you so much, Administrator Brooks Lesher. Thank you for your leadership and for all you have done to expand affordable healthcare access. We know when Democrats are in charge, we deliver on our promises of lowering costs and making healthcare more accessible. This has long been a Democratic priority. It is thanks to Democrats that the Affordable Care Act today provides tens of millions of Americans with coverage. But when Republicans are in charge, they do everything they can to undermine healthcare. We saw this with their signature legislation this year, which kicks more than 15 million Americans off of their health insurance. That was the largest healthcare cut in American history. And now Republicans are doubling down on the healthcare crisis they've created, failing to work with Democrats to prevent the ACA tax credits from expiring. The American people want Congress to work together to ensure health insurance premiums don't go up at the end of the year. The clock is ticking, and open enrollment begins next week. More than 20,000 Californians in my district alone will see their premiums go up from this crisis, and many will see their premiums double. Failure to extend these tax credits is not an option. We'll cue up a video.
While Republicans shut down the government, they're driving up healthcare costs for families. Their big, ugly bill cuts Medicaid, targets Medicare, and takes healthcare away from hardworking people. And now, families are paying the price. In Speaker Mike Johnson's district, a 60-year-old couple's premiums could rise by nearly $20,000 a year. That's not an expense any family can afford. While Republicans reward their donors, Americans pay the bill. That's why Democrats are fighting to protect our health care.
Now, someone who knows this all too well is our next witness. It's my privilege to introduce Mariah Plant. Mariah is a small business owner in Wyoming County, West Virginia, who serves as the main caretaker for her brother, Matt, who is legally blind and nonverbal. Medicaid has been a lifeline for their family. It allows Matt to live at home while covering his doctor's visits and medications. But with Republicans doing everything they can to cut Medicaid, Americans like Matt face serious challenges to getting the care that they need. And caregivers like Mariah worry what will happen to their loved ones if costs go up and healthcare falls out of reach. Mariah, thank you for joining us today and for speaking up in service the tens of millions of Americans who rely on Medicaid like your brother, Matt. You're now recognized. Make sure. There you go.
Warned me to turn that button on and I just flat out ignored it. Thank you very much, everyone, for having me and for taking the time today to hear from us citizens about how these cuts are going to impact all of us. I want to also apologize in advance for my tone. I recognize that we're all on the same side of this fight, but I got a lot of mad in me. And I want people to hear it because I represent the mad that is inside a lot of people in West Virginia, especially in rural parts of my state where we feel like we've just been hung out to dry by this whole process. I know I personally feel like I'm being attacked from all sides. Like I said, my name is Mariah Plant. I'm 29 years old. I'm a small business owner and I live in rural Wyoming County, West Virginia. I work full-time from home while also caring for my older brother, Matt, who again is legally blind, has nonverbal autism, and needs significant help with nearly every aspect of daily life. Medicaid is our lifeline in West Virginia. It pays for his medical care, his prescriptions, his eyeglasses, which are about an inch thick, and behavioral support, which are services that we could never afford on our own. Most importantly, Medicaid allows him to live at home, surrounded by people who love him, instead of at a facility where staff are often overworked and undertrained to care for people with complex needs. Just last year in Preston County, West Virginia, a man not much older than my brother, who is also nonverbal and has lifelong developmental disabilities, lost his life in a facility like this because it was understaffed and underfunded, and the people in charge of his care left him in a scalding hot bathtub for an hour. When they found him, his skin has melted from his body, and he was deceased. He could not cry out in pain. He could not tell them that the water was too hot. He could not even struggle to get himself out of the tub on his own. And I think of that man every time I give my brother a bath. And we switch the water from hot to cold to hot to cold to hot again to a little bit colder. And we switch out the washcloths just so. And we play the special bath time song. And it requires a lot of love and patience that I don't think somebody making minimum wage is going to be able to offer him. Caring for Matt in our home also saves the government thousands of dollars a year compared to what it would cost to house and care for an individual with similar care needs in a state hospital or assisted living facility. But now, on top of threats to Medicaid, my own health coverage is in jeopardy. I currently receive an enhanced premium tax credit, an EPTC, which reduces my monthly health insurance premium from $829, which is double my car payment, down to $218. Very manageable. That covers 77% of my annual premium cost, making it possible for me to afford coverage while caring for my brother. If these enhanced tax credits expire, my monthly premiums will nearly double, jumping from $218 to $388 before I ever see a doctor or pick up a prescription, which, by the way, the one prescription I do take will cost me another $150 a month. That's a devastating hit for working people like me. And I'm not alone. Americans across the country are opening letters from their insurers right now, learning that their premiums are skyrocketing because Congress has not acted. We are facing an unprecedented healthcare crisis. Families are watching their costs explode in real time, and Democrats have been clear. They're ready to negotiate a bipartisan agreement to reopen the government and extend these tax credits so we can stop these massive premium hikes. But Republican lawmakers have to come up off the golf course and off the beach and sit down and negotiate in good faith on behalf of the hardworking Americans like myself who they were elected to represent. You may think that West Virginians are too poor or too uneducated to know when we are being sold a bill of goods, and maybe that's what they are counting on, but there is not one good thing in this bill for West Virginia, and we are not for sale. Where I come from, the stakes could not be higher. If HR 1 takes effect, at least 7 rural hospitals, including Welch Community Hospital, which is the closest medical facility to where I live in Pineville, still 40 minutes away, but a manageable 40 minutes. 7 of those facilities will close within the next 2 years. That means more people driving further for emergencies and regular healthcare visits, more strain on our already fragile healthcare system, and more lives at risk. This ain't about politics. It's about people like my brother, like my neighbors, like my mom and dad, like my sister, and people that we love back at home. We cannot trade their health and security for tax breaks for the wealthy. It is time for Congress to do its job. Extend the premium tax credits and protect Medicaid and put working families first. Thank you very much for your time today.
Mariah, thank you for your mad. We appreciate it. While the Republican Speaker of the House has canceled 2 weeks of votes, Democrats have remained here in Washington, ready to reopen government and lower health care costs for the American people. Republicans in Congress and President Trump promised to lower prices. They haven't. Instead, the Trump tariffs are driving up costs for small businesses and consumers. The proposed Medicaid cuts would leave millions without coverage, and cuts to the Inflation Reduction Act are pushing energy prices higher. Now, as Democrats fight to protect the Affordable Care Act's premium tax credits, House Republicans are nowhere to be found. This is not what working families need. They need stability. They need a government that works for them, one committed to keeping health care affordable and accessible. Republicans like to say the best health care is a job. But even for Americans working full-time in today's economy, affordable health care remains out of reach. One of my constituents, Miss Evans, from a rural community in my district, I have 4,500 farms in my district, plus the city of Chicago, recently shared her story. She works hard in the agricultural industry and loves her job, but her employer doesn't provide health insurance. Thanks to the Affordable Care Act, she can afford affordable coverage through the marketplace. Before the ACA, many women's preventative services were not covered. Today, Ms. Evans receives annual checkups and screenings at no cost. And because she has a family history of colon cancer, the ACA ensures she can continue to receive life-saving screenings. This preventative care not only keeps her healthy, but it also saves her money and gives her peace of mind. But Ms. Evans is worried if the ACA premium tax credit expires, her monthly costs could double. She earns too much to qualify for Medicaid, yet not enough to afford a massive rate hike. If Republicans believe the answer to health care is simply to get a job, then we should ensure that every working American can afford quality health care. I will continue fighting to stop this Republican manufactured health care crisis and to keep costs down for workers like Ms. Evans. Now, I'm very honored to introduce our next witness who understands the impact ACA cuts will have on rural workers like Ms. Evans. I'm honored to introduce our next witness. His name is Dr. Bruce Pulliam, an emergency physician from Southern Oregon who has spent the last 13 years providing life-saving care in a community hospital setting. Originally from rural Northern California and raised by 2 public school teachers, Dr. Pulliam's path to medicine was made possible through government-supported scholarships, loans, and grants. Resources, he said, were essential to his ability to serve the community he now calls home. Today, he brings firsthand insight into how shrinking public investments in education and healthcare is deepening provider shortages and straining rural hospitals. Dr. Pulliam has been a strong voice for policies that preserve access to care and strengthen the healthcare workforce, particularly in underserved communities. Thank you for your work.
Good morning. Again, my name's Bryce Pulliam. I'm proud to be a board certified emergency physician, as well as a founding member and the current chair of the Southern Oregon Providers Association, which is part of AFT's Northwest Medical United Local 6552. I live in Southern Oregon and work in a community emergency room. My colleagues and I show up 24 hours a day, 7 days a week, 365 days a year with one goal in mind: to provide excellent care for patients in crisis. Being a doctor is often challenging, but it's become harder because our nation's healthcare system is on life support. Unfortunately, Republican policies are making this worse. This summer, they worked with the Trump White House to enact a partisan law that slashed Medicaid, and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires. They did this at a time when our healthcare system was already at a breaking point, with a national nursing shortage and too few doctors to care for those who need us. Our nation's emergency rooms are packed. Patients receive care in ER hallways, and hospitals are so full that patients have to wait hours or days to be admitted. The television show The Pit doesn't lie. This is real life. As emergency physicians, we see patients with life-threatening emergencies like sepsis, strokes, or heart attacks. But we also pride ourselves in caring for anyone who comes through the doors, including those who come to us because they have nowhere else to turn. If Republicans succeed with policies that defund healthcare, we will see a crisis at every level of our system. Hospitals and clinics will close or cut essential services, forcing patients to travel further and wait longer for care. Up to 14 million people could eventually lose their healthcare coverage, and millions more will see their healthcare premiums increase. This could literally mean the difference between healthcare and being able to afford rent or groceries for the most vulnerable. If we keep cutting from our healthcare system, we aren't just trimming fat, we're cutting to the bone. That means that someone's neighbor, best friend, or family member, like Matt, will have to forego care, skip medication, or delay going to the doctor. They'll get sicker, and both red and blue communities will suffer. I know this as well as anyone coming from a red district in a blue state. It doesn't have to be this way. What we ask for is simple: protect and expand coverage, invest in safe staffing, and fund community hospitals so care is available where people live. I'm here today for my patients who deserve excellent, affordable, and accessible care. Instead, many are about to receive notice that they're losing the tax credits that enable them to be able to afford health care. All because Republicans' budget prioritizes tax cuts for billionaires over the health of millions of Americans. Excuse me. It's time that Republicans return to DC and do their work. They need to end this government shutdown and work with the Democrats to restore and rescue the health care that's now at risk. I always strive to do what's right for my patients. The Republicans that control Congress and the White House should do what's right as well. Instead of creating a healthcare crisis, they should work with Democrats to fix it. The health of our communities depends on it. Thank you so much.
Well, thank you, Doctor, for your testimony. I want to thank all our witnesses for being here today. I want to thank Leader Jeffries and the congressional leadership for your opening remarks, and to the witnesses all for being here. You know, as has been mentioned, Republicans have the House and they have the Senate and they have the White House. They could end this shutdown today, but they've refused to negotiate with Democrats. And Democrats will continue to fight to protect and save your health care, and Democrats in Congress want to keep your health care affordable. In my district of California's 44th district, 22,000 people will see their health care costs increase, and thousands will lose their coverage entirely. For a 60-year-old couple earning $82,000 a year, annual premiums will increase by $13,783, or 286%. That is insane. It's unacceptable. I now will recognize myself for the purposes of a question. Ms. Brooks LaSure, why is it so important for the healthcare tax credits to be extended now? And why can't Congress wait until December, as Speaker Johnson suggests?
Yeah, so thank you so much for the question. The tax credit should have been extended in April. That's when insurers start making estimates of what the premiums are going to look like. They are what we normally see in a normal year is right now, people who are on the marketplaces should be getting notices telling them what their premiums are going to be. And that's why the tax credits should be extended now. And waiting until November 1st is too late, because when people come to the marketplace to shop and have sticker shock, they don't come back. They leave when they see this is not affordable for me. And that's why it's so important that tax credits be extended immediately.
Thank you. That's such an important point. I now want to recognize my fellow co-chair, Debbie Wasserman Schultz, for a question.
So much, Co-Chair Barragan, and thank you to all of our witnesses. And Ms. Brooks LaSure, you deserve the applause as well. So don't. And thank you for your service. I know that CMS job is a hard one. Dr. Pulliam, you're on the front lines, quite literally, of our healthcare system, and I'd like a sense. Now, don't take this the wrong way, but you look like you may have been around prior to when we had more access to quality, affordable healthcare under the ACA. So, over the course of your career as an emergency room physician, can you talk about how our healthcare system has become increasingly under more and more stress, and particularly when patients can only use the emergency room as their primary access point for healthcare? What does that look like when they can't afford their insurance or their deductibles, and the first time they go for healthcare is when it's an emergency?
Sure. So a lot of parts to that question, but I think first and foremost, just to highlight, our system is under stress and stretched to the breaking point. It's hospitals across the nation facing nursing shortages. In communities, we are losing primary care doctors. We're losing specialists that patients need to see for their advanced conditions. Provider burnout, whether it's nurses, doctors, techs, is at an all-time high, and that's driving even more talented people out of the profession. And yet, what we see is patients who come in to the emergency department because that's the only place they can turn for care because they don't have a primary care doctor or they can't get to a specialist. And it's great. I have a federal mandate to see anyone who walks through my doors, and it gives me a ton of freedom to care for literally anyone or anyone that shows up. But I am not an endocrinologist. I'm not a gastroenterologist. I'm not a neurosurgeon. And sometimes to get those patients to those specialty cares that they need, one, we have to refer them. And if they don't have insurance and can't afford insurance, those visits are cost prohibitive. They are hundreds, if not thousands of dollars. And two, when our system is stretched as thin as it is, I see patients who come in who have a first time seizure, and I say, we need to send you to a neurologist. I refer them to a neurologist. And then I see that same patient 6 months later having another seizure, not on medications, because they couldn't get to a neurologist or a cardiologist or whichever specialty they needed to get to because they're booked 6 months or a year out. Even when even when the specialties are available, our patients are struggling to access them. And unfortunately, the emergency department, we are jacks of all trades and we are there to help anyone, but we can't fix everything.
Thank you. I believe we're going to our co-chair, Representative Robin Kelly, for the next question.
All right, since they will ask questions, I'll ask you. My district is urban, suburban, and rural, and as I said, I have 4,500 farms in my district, and in my district, 2 hospitals if they implement everything they want to, will shut down. So I want you to talk a little bit more about that, the length of time people have to travel and how close hospitals are to you now, or even federally qualified healthcare centers.
Really, thank you for that question. So in West Virginia, we have a threshold that a lot of people go by to determine whether or not seeking healthcare is worth it, right? How bad does it hurt? Does it hurt bad enough to drive an hour or an hour and a half? Does it hurt bad enough to wait in the waiting room once you get there for another hour and a half or more? And so what ends up happening is that a lot of people don't go to seek healthcare in the first place, right? They just suffer in silence because that's the West Virginian tough bootstrap thing to do. The further and further away and the less accessible these facilities become to regular everyday Americans, the more that culture of suffering in silence is going to pervade. People are going to die younger, they're going to get sick younger, and their overall quality of life and ability to work and earn a living is going to suffer as a result. I know for me, as a 29-year-old woman who is lucky and deeply in love with my boyfriend, we want to get married one day and possibly have a family. That's a really big deciding factor for me. Do I want to risk getting pregnant in a state where reproductive health care is so dangerous and tenuous and risk the now 40 minutes, soon to be hour and a half long drive to the closest hospital if something does go wrong or when I eventually might need to deliver the child? That's going to factor in heavily to whether or not we decide to grow our family in West Virginia, whether or not I can afford to continue to live in the state that I love so deeply. Because at the end of the day, it's going to come down to the pennies, right? And how bad does it hurt? I hope that answered your question.
Thank you so much.
Bonamici.
I really appreciate it. And I wanted to ask you, I'm from Oregon, Dr. Pulliam, welcome. And in our state, in large part because of longtime leadership in our state legislature, about 97% of Oregonians do have health insurance right now. But like Representative Kelly, I represent a district that has urban, suburban, and rural. In fact, I was just at a ribbon cutting of a community health center out in rural Tillamook County over the weekend. They're extremely concerned about possible cuts. In Oregon, the average increase in premiums for people will be more than $1,000 if the tax credit bill is not remedied, and that's what we're here to fight for. But what I wanted to ask, and if each of you could respond briefly to this, sometimes people say, well, the Medicaid cuts don't affect me because I'm not on Medicaid. So can you talk about what it means to everyone if these cuts go through, if the Medicaid cuts go through, if the premiums go up, what does that mean to everyone in Oregon or in your state? So I want to get the message out there that this doesn't just affect people on Medicaid. Thank you.
Lee, do you have a question?
I'm happy to start and just to
Give me the
say,
answer.
Medicaid has become so important. It's important to our states. It's certainly important for the people that rely on it, but it's also important for our healthcare providers. And what we're hearing is just how much a lot of the healthcare system was already taxed. Medicaid was helping a great deal. Most of the rural hospitals in this country get a lot of their revenue from Medicare and Medicaid. And so the cuts to the program, whether it's fewer people being enrolled or whether it's states not being able to spend as much money, means that some of these facilities will not be able to stay open. And a lot of our country, already people have to travel for a distance to get their care. And so we're already seeing that hospitals are saying, hey, in 2 years, my revenue is going to go down. And that's why we're already seeing and hearing reports of provider systems not going ahead and investing in expansion, closing their doors, certain parts of their programs like labor and delivery, or closing their doors altogether.
We just had a labor and delivery unit close in Seaside Hospital, which is on the coast in a pretty rural area. And the question is, well, where do you go now? Dr. Pulliam?
Yeah, so I can speak to this as an emergency physician, and it's not unique to any one hospital. Waiting rooms are full. Patients wait hours, sometimes 6, 8 hours to be seen in our ERs nationwide. Um, and if we are the only place that people can turn to get even the most basic care, we are thrilled to be able to care for them. But also, there are only so many doctors, there are only so many nurses, and those wait times are going to go up. Patients who are legitimately sick will be in the waiting room hoping that someone gets discharged or a bed becomes available. To speak to, clinic closures, we have a large population of Medicaid patients in our valley in Southern Oregon where I work. And clinics rely on those patients to keep their doors open and keep the lights on. And if those patients can't afford care even when they need it, those clinics will have less patients, not be able to sustain their operations and close. And so even patients who did have private insurance or are millionaires aren't going to be able to get into specialty care that they need,
Right.
because all of us are funding the healthcare system. We all need healthcare. It is a universal need. And clinics are there to care for everyone and expect to care for everyone.
Thank you. Ms. Plant, did you want to add anything to that?
I think that Dr. Pulliam really hit the nail on the head, and it's important that we all recognize that these cuts aren't going to trickle down and affect everybody. They're going to hit us like a tsunami. It's going to hurt really, really, really bad. Because if you go to a healthcare facility that accepts Medicaid, period, Medicaid helps fund your healthcare, because the doors aren't just going to close for poor people. They're not just going to close for the uninsured. They're not just going to close for people on Medicaid. They're going to close for all of us. And no matter how much you have in your bank account or how fat your wallet is, when you drive up to Welch Community Hospital and the doors are locked and the lights are off, you're up a creek. Literally, it's up a creek.
Okay.
Thank
so
you. I yield back.
Thank you. And we'll just ask members to stick to one question, please. Representative Beatty.
Thank you. I'm from Ohio, and while I don't have a lot of farms, I have a lot of small municipalities that would be what I'm going to call rural-like. And then I have a lot of suburban and inner city. And so I think it all works the same. But I want to piggyback on my one question off of Congresswoman Bonamici in a more direct way. You've all answered it or stated to it, but we get a lot of people who think that there are Medicaid nurses, and I need you to tell me that that's not true, and Medicaid doctors. And to your point, Mariah, they then think it doesn't affect me because that's the Medicaid part. And I think it's very important for America to hear what this Republican administration is doing, is giving us false information or leading us to believe false. So if each one of you on the record in the mic could say that, and you've kind of touched on it, that there are not Medicaid nurses or assistants or doctors. Matter of fact, with the law, they don't even know when people are coming in what their billing is. But I think that is so important because people have said, oh, it won't affect me. I'm not on Medicaid. And I can see a nurse or a doctor. Thank you.
So yeah, as an ER doctor, again, I get to see anyone who walks through the door, regardless of what their insurance is, or even if they don't have insurance. I'm a doctor for everyone, but Medicaid helps fund our emergency department. It pays for techs, it pays for doctors, it pays for nurses, along with your private insurance. We are not one or the other, all or nothing. We are everyone.
The answer. Representative Horsford.
Thank you, Mariah. Thank you for centering the voices of real people and your brother, Matt. It's a blessing. I'm sure that you are in his life and that you're providing him the care and attention that he needs. I wanted to ask you, as a small business owner, we're dealing with a lot of policies that are creating a lot of economic uncertainty for small businesses. So can you talk about how difficult it is to start a business to begin with, and particularly as it pertains to healthcare cost, how these enhanced premium tax credits have allowed you to have the coverage as a small business owner, and what does that impact to other business owners if that goes away or is not available to you?
And thank you for that question. So for me, as a small business owner, which has been my dream my whole life, is to run an arts educational program for teens and tweens in Appalachia. And that's what I get to do for a living, is play pretend. It's so much fun. But we are currently experiencing a time where parents can no longer afford to send their kids to extracurricular activities that cost money. They can't afford to contribute towards costumes and sets. And so I'm seeing it on one side of my direct income is being hit by people not being able to access these little extras because the economy is already hitting them so hard. But then also from the other side of it, as a person who needs healthcare, who needs to be able to take my medication and get my glasses and all that good stuff, um, $388 is the difference between, like I said, 2 car payments. It's the difference between whether or not I can afford to pay my insurance for my business. It's the difference between whether or not I can afford to buy supplies. And it's making me ask that same question about the threshold. How bad does it hurt? Does it hurt bad enough to sacrifice this part of my budget in order to go and get care? And for me, I can say that if the EPTC goes away, I simply will go without. I will not have health insurance, and I will not go to the doctor because I can't afford to. So this really is a life or death situation for myself and for so many other people who are young and bright and inspired and want to contribute to our society and be successful. But it really feels like there are chains dragging us down, and that our state, our country, our government is not rooting for the small business owner, for the middle class American. And that's really where I'm feeling it, is on both sides of my income and also the healthcare piece.
Mark.
Thank you so much. I just want to thank you, Mariah, Dr. Pulliam, for really just putting the human face on this and what this fight is about. And that's why we're in this fight. And thank you for sharing the story of your brother. It's those stories of how families come together and provide for the ones they love, and how these tax credits, Medicaid, all work together to give people a solid floor so they can have no ceiling on the success and the ability to care for their families and to build a business. And we're just really grateful for that. That's our motivation for this fight. It is our motivation why we are imploring Republicans to end this shutdown, come to the negotiating table. But Republicans are trying to define this as something else. So I am hoping that you, Chiquita, can clarify for us. Isn't it true that under federal law, only citizens or legal residents are able to obtain coverage under Medicare, Medicaid, and the ACA?
Yes, the law is quite clear that to be enrolled in Medicare, Medicaid, and the Affordable Care Act, you are either an American citizen or you are a legal immigrant. And the idea that this is anything other than fighting for the American people, the millions of hard-working Americans, is just completely false.
Thank you. I yield back.
Thank you so much. Thank you, Whip Clark. And thank you all for your testimony today. I know it's not easy to step forward like this, but it's incredibly helpful and important for us to hear your firsthand account and stories. And it's clear that America faces a healthcare crisis that we must solve immediately. This is a right now problem for millions of Americans. Co-pays, premiums, and deductibles will skyrocket, and millions will soon be priced out of any coverage at all. And that drives up costs for everyone. House Republicans are AWOL. They need to end their paid vacations and negotiate with Democrats on a spending bill that avoids this GOP healthcare crisis. Ignoring a crisis that guts healthcare for tens of millions of Americans is unacceptable. And canceling 2 weeks of votes isn't a negotiation, it's an abdication. We need an honest dialogue to find real solutions. But GOP lies about immigrants getting tax credits and Medicaid just pollutes our prospects to solve this crisis. Every reputable journalist who looks at this fraudulent claim determined that it is a pants-on-fire lie. What is true is 20 million Americans face massive price spikes on their healthcare bills, with premiums doubling. What's also indisputable is Republicans' historic Medicaid cuts, which will already result in 15 million Americans losing healthcare. Those are real, verified facts. So let's start there and bury Republicans' immigrant-bashing lies and have a real debate and negotiation. Let's watch this video to break it down.
They would rather give taxpayer-funded benefits to illegal aliens.
That's just not true. Fact. Undocumented immigrants can't get federal health care programs, no comprehensive Medicaid, no ACA subsidies. Here's another fact. Republicans are trying to take health care away from 15 million Americans and raise health care premiums for millions more. Healthcare costs are rising because Republicans want to give tax breaks to their billionaire friends, not because of immigrants. Stop the lies. Protect healthcare for all Americans.
Well, thank you. As we come to a close of this portion of the hearing, I want to thank our witnesses, the Honorable Brooks LaSure, Ms. Mariah Plante, and Dr. Pulliam, for your expertise, for uplifting how these healthcare cuts harm our communities. Your stories and your testimony is so, so powerful. House Democrats will not stop fighting to protect healthcare for all Americans. And with that, we will now transition to the second panel of this hearing. We will hear from members directly on how their constituents are impacted by this Republican healthcare crisis. We are starting with panel number one, Representative Rob Menendez, Representative Greg Stanton, and Representative Mike Johnson. On policy, and now we're with panel number one. We have three members that are here to testify. We will start by seniority over here. I'll start with you, Representative Mike Thompson.
Thank you very much. Thank you for holding this hearing and shining a light on this very serious issue facing all of our constituents. Over the past week, House Republicans have literally gone on vacation while millions of Americans are facing an unprecedented healthcare crisis. The Affordable Care Act premium tax credits that help millions of hardworking Americans afford their insurance are set to expire. Because Speaker Johnson refuses to hold votes, Americans, our constituents, will suffer. In my district, the numbers are pretty staggering. A family of four making $129,000 a year will pay $14,444 more for their health care, a 161% increase. A 60-year-old couple making $82,000 a year will pay $23,788 more, a 526% increase. Who in the hell can afford to pay that type of money for insurance? It is obscene what they are doing, what the Republicans are doing. Nationally, the picture is just as bad. More than 24 million Americans will either face higher costs or lose their coverage altogether, including 1,600,000 children, 3,300,000 small business owners. And remember, when we did the Affordable Care Act, a big part of the justification and why it was so supported so strongly is because it allowed small business owners, self-employed individuals, to finally get health care coverage. And the irony is more than half of the Americans affected live in Republican congressional districts. Even our Republican colleagues are sounding the alarm. I never thought you'd hear me say I agree with something that Marjorie Taylor Greene said, but I do. And I quote, "My own adult children's insurance premiums are going to double, and not a single Republican in leadership has given us a plan," end of quote. At the same time, Medicare telehealth coverage has lapsed. Doctors across the country are canceling appointments. One woman who called my office said that without a telehealth option, she can't afford to get her care because she lives so far away. The Uber bill is $100 each way. There's bipartisan support to fix this, but the Republican leadership won't call their membership back, and they won't allow a vote on the floor. And let's remember, by federal law, undocumented immigrants, notwithstanding all the malarkey we're hearing, are not eligible for federally funded health care. Congressional Republicans know this, but they're spreading disinformation. Madam Chair, they're lying. They're lying to distract from their inaction. Democrats are here, ready to protect Americans' health care. It's time Republicans come back to work. Again, thank you for holding this hearing. It's extremely important for my constituents, as I know it is for yours. I yield back.
Well, thank you, Mr. Thompson. I now recognize the gentleman from Arizona, Representative Greg Stanton.
Chairwoman Barragan and the other members of Steering and Policy. This is an important hearing. We're on day 8 of a government shutdown, all because Donald Trump and the congressional Republicans would rather shut down the government than work with Democrats to do the right thing, to protect Americans' health care. After Speaker Johnson canceled votes again, I spent the last few days in Arizona meeting with the people who will pay the price if Congress lets the health care tax credits die. On Monday, I sat down with small business owners. One of them was a young entrepreneur who runs a thriving salon in Phoenix. She pays $280 a month for ACA coverage, steep, but manageable. That insurance lets her get the care she needs to keep working. Without these tax credits, she will lose her business. Her exact words, quote, "Let me keep doing what I love without sacrificing my health to do it." Another entrepreneur from Chandler wrote to my office terrified. After medication, bills, and rent, she has $200 left each month for groceries and everything else. That's on a good month. She ended her letter to my office with this, quote, "I'm begging you with all my heart not to give in no matter how long it takes." This is not a political game. These are real people facing impossible choices, groceries or healthcare, a roof over their heads or treatment for their children. Their dream of owning a small business or peace of mind that if they get sick, they won't go bankrupt. None of us want to shut down. We hate the shutdown. It hurts federal workers, thousands of them in Arizona, and everyone who depends on them. But I can't look at myself in the mirror if I abandon my constituents who are barely hanging on. If these tax credits expire, the average Arizona pays almost $800 more out of pocket. Families, thousands more. That's a luxury price tag on something that should be affordable. People don't stop getting sick when they lose insurance. They stop seeing doctors. They skip preventative care. They cancel appointments. Then, when something treatable becomes critical, they flood emergency rooms, overwhelming our healthcare system. A Phoenix doctor told me this week, quote, reducing access to preventative care dramatically delays and increases the cost of care. When people finally do come into the doctor's office, it's because they're in a really dangerous situation. This is a manufactured crisis by the congressional Republicans, and it has a simple solution. Extend the tax credits. House Democrats, we're here. We're ready. We can fix this crisis today. Republican, my friends on the other side of the aisle, come back to the table, extend these critical ACA subsidies, end this shutdown. That's exactly what the American people want, they deserve, and they need. I yield back.
Well, thank you, Mr. Stanton. I now recognize the gentleman from New Jersey, Mr. Menendez.
Thank you, Chairwoman. Thank you to my colleagues on the committee for giving me the opportunity to speak today. Let's be clear about where we stand. This shutdown is no accident. It's a direct result of the Republican healthcare crisis and the broader effort to roll back the Affordable Care Act and to make healthcare more expensive for all Americans. This week, I visited the North Hudson Community Action Corporation, a cornerstone of our community and one of New Jersey's largest federally qualified health centers. North Hudson Community Action operates 10 health centers, 4 Head Start and Early Start facilities, and 2 social services offices. They accommodate over 268,000 patient visits every year. Families, workers, and seniors who rely on them for everything from medical and dental care to behavioral health and early childhood education. They employ more than 750 dedicated, hardworking staff, people who have devoted their lives to helping others. But what I heard during my visit was deeply concerning and a reminder of the real world consequences that Republicans' actions have on all of our communities. Their team told me how the uncertainty caused by the Republican led government shutdown is threatening the very programs that our neighbors rely on. Programs like WIC, Head Start, and public health. These are lifelines for working families in Hudson, Bergen, and Passaic counties. And yet Republicans are using them as bargaining chips in a political game. Republicans' health care plan will devastate access and affordability for people who rely on North Hudson Community Action and organizations like it. And unless we act soon to extend ACA tax credits, premiums are set to rise drastically for families across the country. A family of 4 in my district making $64,000 per year will see their annual premiums more than triple. That is completely unacceptable. That's why House Democrats will continue to hold the line, fighting to expand healthcare access, lower costs, and fund the government responsibly. We believe that federally qualified health centers like North Hudson Community Action deserve stable funding so they can continue doing the life-changing work that they are committed to doing every single day. I told the team at North Hudson Community Action that I would carry their message back to Washington, and I am thankful for the opportunity to do so today. But more than that, their team and the thousands who rely on them are counting on us to take action. This fight is too important, and we are in it together. Thank you, and I yield back.
I want to thank our first panel for your testimony. Hearing about your constituents is a testament of this being a problem across the country in every district. If we had Republicans here today, maybe they would share some of their stories. At some point, we'll hear from constituents, hopefully across this country. And with that, we will move to the second panel of members. We have Representative Glenn Ivey, Representative Suzanne Bonamici, and I see Representative Deborah Ross is here. We will have Representative Ross. Okay, we will start with Representative Suzanne Bonamici.
To the Steering and Policy Committee for holding this important hearing to expose the Republicans' continued assault on Americans and their pocketbooks by making devastating healthcare cuts and driving up the cost of health insurance significantly. Republicans' cruel budget, the big ugly bill, will decimate Medicaid to pay for tax cuts for billionaires. And now they're continuing their heartless obsession with destroying the Affordable Care Act. These Republican policies are putting rural hospitals and clinics at risk of closure, which hospitals and health systems in my state of Oregon described as catastrophic. Last weekend, I joined a celebration for the newly opened Nehalem Bay Health Center and Pharmacy. It's in a rural coastal town in the district I'm honored to represent. The center is replacing an older clinic and doubling the capacity of the patients who can be served. Hundreds of people showed up in support. And these rural clinics are critical. Without clinics like Nehalem Bay, people are forced to travel for hours, sometimes on dangerous roads at night, to seek the care they need if they can find another provider. And the Republican assaults on our healthcare system put rural clinics like Nehalem Bay and others and the patients they serve at risk. These cuts to healthcare and the Republican shutdown more broadly are emblematic of the first 9 months of the Trump administration, causing constant chaos and inflicting incredible harm to people and families. Too many Oregonians and Americans already struggle to afford health care. I will not be complicit in the Republicans' plan to kick millions more off of their insurance, or if they get their insurance through the ACA, to make their costs skyrocket. In my district, a family of 4 earning $64,000 a year would see their premiums rise 275%. This is unacceptable for families who are already counting every dollar to afford necessities. This past weekend, I held 2 town hall meetings, something most Republicans still refuse to do. And I heard that many of my constituents are extremely worried about the already high cost of living and how these Republican healthcare cuts will further harm them and their families. My constituent has a son who's an adult with developmental disabilities. And because of Medicare and Medicaid, his son is able to live independently. Cuts and reductions threaten that independence. You know, Donald Trump said he was going to lower costs, but his chaotic policies are making costs rise, not fall. People across the country are struggling to pay for housing, groceries, and childcare. And if healthcare premiums skyrocket, they will reach their breaking point. Oregonians and Americans are desperately trying to understand why Republicans are choosing to fund tax cuts for billionaires and halt essential government programs rather than helping hardworking people who are already struggling to get the care they need. Democrats in Congress are fighting to protect health care and are imploring our Republican colleagues to join us in ending their shutdown and in ending this impending and preventable further healthcare crisis. The American people deserve better than they're getting from this administration, and these recent attacks on healthcare are yet another example of why. Thank you very much. I yield back.
Thank you, Representative Bonamici. I now recognize Representative Deborah Ross.
Thank you very much, Madam Chair and members of the Steering and Policy Committee, for holding this important hearing where you can hear about what is happening around the country to people's health care. I'm proud to stand with my colleagues today and speak about the dangerous and deliberate choices that brought us to this point. The Republican-led shutdown is not over policy disagreements. It is the direct result of the extreme agenda that treats access to health care as expendable and views the well-being of working families as a bargaining chip. At the center of this crisis is the GOP's refusal to extend enhanced premium tax credits, which have helped millions of Americans afford coverage on the ACA marketplaces. These tax credits have kept families afloat in the face of rising costs and economic uncertainty. In my home state of North Carolina, nearly 900,000 people have seen care that keeps Zoe thriving and out of the hospital. Leah Carlton, a resident of a rural mountain community in western North Carolina, suffered multiple strokes and lives with ongoing complications. Without the enhanced premium tax credits, her insurance costs will skyrocket to nearly $30,000 a year. And she told me plainly, without this coverage, she may not have survived. Furthermore, she may not have made it to the hospital at all, for the rural facility that treated her is now at risk of closing under Republican efforts to cut federal Medicaid funding for rural hospitals. North Carolina has made extremely effective use of federal health care dollars. Our long overdue Medicaid expansion has helped fund and stabilize rural hospitals, expand access to behavioral health and substance abuse disorder treatment, and integrate whole person care through programs like Healthy Opportunity Pilots, which address social drivers of health such as housing, nutrition, and transportation. That progress now hangs in the balance. If the enhanced premium tax credits are allowed to expire and the deep cuts to Medicaid take effect, the impact on our state will be catastrophic. On my way here, I was on the plane with a Republican state senator who has come to Washington, D.C. to talk about the effects on Medicaid and ask for federal government assistance. He may not be talking to the House members from his party, but he sure talked to me, and I hope he talks to our senators. Instead of acting to preserve programs that have been transformative to millions of American families, House Republicans are walking away. They let the clock tick down and refuse to guarantee credits remain in place, leaving families in limbo, insurers in flux, and state exchanges unable to provide certainty for the next cycle. And this isn't occurring in isolation. It's part of a much broader pattern where my Republican colleagues choose to harm the welfare of working Americans in order to reward the wealthiest among us, cutting essential programs and weaponizing federal agencies that sow divisions. The big ugly law, which slashes more than $1 trillion from Medicaid and makes it harder for people to enroll in Medicare and CHIP, will leave millions of Americans uninsured. And that's not just a budget. It's a blueprint for decimating America's healthcare system. The shutdown the Republicans engineered is accelerating the very crisis they created. And it must stop. Families across the country are watching their premiums spike, some hundreds of dollars a month, because House Republicans are holding these tax credits hostage. It's cruelty masquerading as fiscal responsibility. So I urge my Republican colleagues to get back to work, end this shutdown, extend the tax credits, reverse the cruelest cuts in H.R. 1. Families in North Carolina and across the country are watching and waiting. Thank you, and I yield back.
Thank you, Representative Ross, for sharing the stories of Shannon, Zoe, and Leah, and so many others. With that, I recognize the gentleman, Mr. Ivy.
Thank you, Madam Chair, and I want to thank the committee for hosting this hearing. I think this is super timely for sure, particularly for my community. We're in the middle of the government shutdown. I have tens of thousands of government employees who are suffering from that, but they understand that the healthcare crisis is critical, and they're strongly in support of us linking those two together because the Republicans have dug such a deep and dangerous hole with respect to healthcare coverage across the country, and they understand that. They know that the $1 trillion in Medicaid cuts is going to have a devastating impact on many Americans, not just in Prince George's County and not just in Maryland, but across the country. And ripping away the ACA tax credits has been devastating as well. We have, just in my county, the impact of those two things combined together, for example, with respect to the premium increase, a 60-year-old couple's looking at $11,581
tax increase in 1 year. That's $1,000 per month. That's the type of premium work spike that these couples, these communities are facing. Family of four is looking at a 200% increase under the same issues. So it's critically important for us to make sure we maintain this fight and keep pushing forward to make sure we protect the rights for Americans to have basic access to health care. I did want to mention too, I've been getting a lot of questions from people about where are the House Republicans? I do want to make sure the public understands that the game they played was to try and pass a bill that they knew would be DOA and arrival when it got to the Senate. And they left town quickly, in part so they wouldn't have to be here to try and fix what they'd done, but also so they wouldn't have to deal with the Epstein files, because they knew we were about to pick up number 218 and have enough people to get that passed so we could force them to move forward on that. And then they had the nerve to complain and say that, we don't have enough time to work something out on this healthcare issue, so let's just pass the clean bill. Forget that. For 7 months, starting from January 20th, we knew this day was coming, and they knew it was coming too. And when they passed the big ugly bill that contained the $1 trillion in tax and cuts to Medicaid, they knew the problem they were creating, because we presented it to them. We fought them about it with amendments and the like in committee. And then with respect to the Affordable Care Act, refusal to extend those tax credits to protect the American people, they knew about that too. Deborah Wasserman Schultz there is on the committee with me on during the fight when we were trying to present amendments to try and change that, and they voted them down every time. I think it was 3 at least on a party line vote. So they knew it was coming. They moved forward with it anyway. Then they passed that bill that they knew was going to be a DOA. Then they ran from town, and now I don't know if they're in the witness protection program. I don't know where they are, but they need to come back. And the last point on this, and I'll turn it back over. People are asking about whether members of Congress should be paid right now, and I'll say this: the only federal government employees who should not be paid right now are House Republicans, because they're the only ones who are not here doing their job. They knew the mess they created. They left town, and they're trying to stay away because they're afraid to come back and deal with the mess and try and fix it. So with that, I'll yield back, but I want to thank the committee again for the work that it's done on this and for putting this together.
Thank you so much to our member panelists. This panel is excused, and we'll next turn to Representative Sarah Jacobs, Representative Dave Min, and Representative Brad Sherman.
That they're offering us a clean CR. First of all, yes, it reads like clean CRs I've voted on and voted in favor of before. But there are 2 issues. But they basically were sending a clean CR to a president with dirty hands. So first, they refused to put in a provision that prohibits clearly and with teeth impoundment of the funds that we send. And second, they refuse to put in a provision preventing rescission. So what does this mean? It means we're supposed to pass a continuing resolution to provide funds for all of the functions of government, including ones that they support far more than we do. And then the president is free to defund whatever priorities he doesn't want, or to send to the Congress a rescission of any provisions. So instead of us agreeing that we continue government funding at the same level, they've got 2 mechanisms to defund Democratic priorities while funding Republican priorities. We're told that they'll negotiate on health care just as soon as we pass their bill. They wouldn't negotiate on health care in January. They knew in February that these credits were going to be abolished and 22 million Americans were going to face massive increase in their premiums. They knew that in March when they wouldn't negotiate. They knew that in April when they wouldn't negotiate. And come July, they said, you know, not only won't we negotiate regarding the people who are going to lose their Obamacare subsidies that are necessary because otherwise their premiums double, we're going to take health care away from people on Medicaid. So they won't negotiate with us for all these months. Now we're supposed to give them what they want, and then they're going to negotiate? I don't think so. Fool me once, shame on me. Shame on you. Fool me twice, shame. Now, we have seen what happens when federal employees don't get paid. Burbank Airport lost air traffic controllers, a major airport close to my district. Massive delays. Why? Because some air traffic controllers decided to call in sick, as we're seeing that across the country. Now, the National Association of Air Traffic Controllers has urged their people to show up unless they are physically sick. But I have a difficult time telling people we're not paying you, but you show up for work. Now, why are we here? Why are we even talking about a continuing resolution? That's not the way to run government. There are 12 appropriations bills that should have passed the House of Representatives in the spring, maybe the early summer. And they should all have become law months before September 30th, because the people that run the government should have known months before their year began on October 1st what their budget was. Well, have Republicans who control both houses of Congress passed these 12 appropriations bills that function different parts of government? Not a single one. They haven't done their job, not in January, not in February, not in March, not in April and May. They have only 3 of those bills have passed the House, and none have passed, and of those 3, none were supported by the Senate. So why is Congress shut down? You know, the last time we had a major major shutdown, it was when Congress was not scheduled to be in session. It was Christmas. But the time before that, Congress was open. We have to be open. If any federal employee is essential, Congress is essential because we're the only ones that can open the government back up. So what we were doing in 2013 when we had a shutdown, we had hearings on FEMA. I represent the Palisades. Those were important hearings. We had hearings scheduled today before judiciary to deal with the Epstein files. No wonder Congress is shut down. We can't open up the government till we bring Congress back into session. Now, there is an issue where Democrats are divided. Some believe that all Republicans have been sent home because maybe some of them would talk to us about health care, and their leadership doesn't want to do anything on health care. Another chunk of Democrats believe that they sent everybody home so that we wouldn't talk about the Epstein files and we wouldn't swear in Ms. Grijalva, who will then sign the discharge petition and force a vote on the Epstein files. I think both Democratic groups are right. They don't want to talk about health care, and they certainly don't want to talk about Epstein. So Democrats need to fight for those millions who are losing their health care, including, and I have the statistics for California, but I've gone on too long, and I bet you my colleagues from California will bring those statistics up. But millions of Californians are losing their health care because Republicans wouldn't negotiate in January, they wouldn't negotiate in the spring, and they won't negotiate now.
Thank you. Thank you, Representative Sherman. Members are reminded that each panel has an allotment of 10 minutes total. So if you could keep your remarks brief, that would be helpful. And Representative Jacobs of California, you're recognized.
Well, thank you. And I'm honored to be on this esteemed panel of Southern Californians. Thank you to the Steering and Policy Committee for convening this hearing today. One thing I think we need to be clear about is that the Republican shutdown didn't actually begin on October 1st. It began on January 20th. Since he took office, Donald Trump has been shutting down our government and stealing power through DOGE, mass firings of federal workers, slashing federal programs and departments, ignoring Congress's constitutional role, disregarding court orders, deploying the military on American soil against Americans, and so much more. So we should all be clear that whether or not we are in a technical government shutdown, it doesn't change Trump's calculus. It's not going to sway him if he wants to break the law and fire people or illegally deploy our troops on American soil, because he did it before. That's why this isn't business as usual. It's why there's no such thing as a clean state, and it's why we need concrete guarantees that this administration will respect checks and balances, recognize Congress's power of the purse, and protect Americans' health care. So here are the facts. Republicans control the House, the Senate, and the White House. If Republicans want any Democratic votes, they know what it will take to earn them. We've told them. So they need to show up to work, they need to talk to us, and they really need to come to the table. So here's what Democrats are fighting for. We want to reverse Republicans' devastating Medicaid cuts that kick millions of people off their health care. Over the past several months, I've met many constituents who are the collateral damage of these cuts. I met 5-year-old Delilah Knight at Rady's Children's Hospital. She is possibly the happiest kid I've ever met. You wouldn't know that she has 28 different diagnosed medical conditions and about 6 medical appointments per month because she's constantly singing and laughing and dancing. I met 2-year-old Caesar, who has short gut syndrome, retinal detachment in his left eye, and hearing loss. He has between 20 and 30 medical appointments per year that Medicaid helps coordinate and cover. I also met Marie at San Ysidro Health Clinic in El Cajon, who's getting help with her diabetes thanks to Medicaid. And I met Jesse, who got hurt on the job, and Medicaid was the only reason he was able to get the rehabilitation he needed so that he could go back to work. These are the Americans we're fighting for. We're also fighting to extend life-saving ACA premium tax credits, because if they expire at the end of the year, most people will see their premiums double, if not more. In my district, a 60-year-old couple that makes $82,000 a year will see their premiums go up by $15,000. $15,000! That's crazy. That means more people won't be able to get their chemo, their heart medication, their insulin. Increases like that mean millions of people will be priced out of their health insurance. And on top of that, hospitals and community health centers will see more uncompensated care because instead of getting regular checkups that are cheaper and preventative, people will have to go to the ER when it's life-threatening and expensive. This shifts financial pressure onto hospitals, local governments, and insured patients through higher premiums and hospital bills for the rest of us. And lastly, we're fighting for any deal that we negotiate to actually be honored. Much to Donald Trump's dismay, we have 3 co-equal branches of government in this country. And per the Constitution, Congress has the power of the purse. The president needs to respect that whether he likes it or not, and he can't just decide when to disperse funds on a whim. None of us takes this shutdown lightly, especially not me. I represent San Diego, the biggest military community in the country, which is home to 47,000 federal workers. These federal workers, from air traffic controllers to TSA agents to researchers, are either furloughed or working without pay. Our service members are working without pay too, making it even harder for our military families to make ends meet when they already struggle to afford housing, childcare, and put food on the table. 45,000 service members and military families already visit the San Diego Food Bank every single month, and that's when we're not in a government shutdown. It's not a guess or a prediction that that number will go up. American families are at a breaking point, on the edge of not being able to afford healthcare or access federal programs they rely on because Donald Trump is hell-bent on taking them away. That's why we're here. We're not going away, and we're going to keep fighting to protect Americans' healthcare and make sure our government actually works and delivers for people. Thank you. I yield.
Thank you very much, Congresswoman Jacobs. Congressman Dave Min from California as well.
Thank you so much, Madam Chair and members of the DSPC for holding this important hearing today. I am a freshman, just got elected in one of the closest races in the country last year. Before coming into politics, I was a law professor, and I've just been shocked by the lawlessness we have seen this year, whether it is deploying troops in our streets, whether it is the assault and kidnapping we see on a daily basis from ICE agents, whether it is the illegal cuts to appropriations made by Congress, and on and on and on. I've watched stunned this year as this Congress has refused repeatedly to stand up for our Article 1 constitutional authorities. And in fact, as we have over and over again greenlit ex post facto the illegal actions that Donald Trump and his administration have undertaken. And we are here right now in a shutdown. We are out for 3 weeks. And this seems to me to be a continuation of this pattern of condoning lawlessness from this particular feckless Congress. I've sat here for 9 months and not once been lobbied as a swing member to vote for any of these Republican bills. They have rammed through some of the most extreme, no, not some of the most extreme radical agenda, lawless agenda in history. And not once have they asked for votes from me or my fellow swing seat members. And now they're trying to blame this on Democrats. This is Donald Trump's Congress. This is Donald Trump's administration. This is Donald Trump's shutdown. And it is unfortunately having massive negative impacts on the constituents I represent. And let's be clear what this particular issue is about. This shut is going to also other things lead to 15 million Americans lose. After that, Medicaid, the $1 trillion in cuts to Medicaid, potentially another $500 billion extreme policies. And that is what Democrats are standing up for right now. In home district in Orange County, which is a relatively wealthy tens of thousands are going to lose their health care. People don't do something about not abstract cuts we're talking about. They're cuts that will harm real people. She works insurance, single bins across the country cannot. These are people who we're talking about who will die, and retirees and rural residents across the country. Then we'll see higher individuals for 50,000 and increases on average for 75% or more, or even quadruple. I will just tell you, I want to see us stand up right now. They want to see us of the administration, Congress that refuses to act to hold Donald Trump in check. I recently had a chance to meet with my air traffic controllers, and while they are going to work right now, and they're being encouraged to do so by their union, they also are going without pay. Their families are struggling. They don't know how long this shutdown is going to last. And I'll just say that they told me specifically, we need you to stand up and fight. The stakes of this are much more important than us losing pay for a couple weeks. We need you to stand up and fight back. And it's not lost on me as a member of the Oversight Committee that this 3 week of us not being in session, of Republicans not being here, of Mike Johnson closing off the House floor, of not seating Adelita Grijalva, the ICE raids, the troops in our streets, they are all grossly unprecedented. Many of these actions are grossly illegal, but they're also effectively a way to distract from the fact that this administration also is engaged in a massive cover-up of the Epstein files. that they refuse to produce these, that Donald Trump has called these a hoax. As someone who sits on the oversight committee, who's talked with the survivors of some of the survivors of the Epstein child sex trafficking ring, let me tell you, this is not a hoax. There are documents out there that we need access to that I think will expose a lot of light onto the breadth and scale of this operation. We demand justice for the survivors, transparency for the American people, and that is also part of why we need to stand up right now, because people deserve transparency and justice. And with that, I yield back.
Thank you so much to our panelists. And as they make their transition, we'll ask Congressman Jamie Raskin of Maryland, Congresswoman Emily Randall of Washington, and Congresswoman Kelly Morrison of Minnesota to make their way to the witness table. And Congressman Raskin, as you hustle to your seat, you are first.
Thank you, Madam Chair, and thanks to the committee for doing this. If your name's on the ballot, your face should not be on the milk carton. And all we say to our Republican colleagues is show up for work like the rest of America does, because we need you here negotiating an end to this healthcare debacle the Republicans have imposed on the country. I've got 23,000 constituents who receive ACA tax credits that are about to go up dramatically, in most cases double or even triple. A 60-year-old couple in my district earning $82,800 a year are about to see a premium hike of 168% or $11,581. How many people can afford to pay an extra $11,000 a year for their health insurance premiums simply because the Republicans want to shut down the government and throw millions of Americans off of their health care? That doesn't make any sense. I just want to tell you about a couple people in my district, concretely what all this means to them. I have a constituent, Cheryl, who's an occupational therapist, and she directs a wonderful boxing exercise program for people who suffer from Parkinson's disease. It's called Rock Steady Boxing in Rockville, Maryland. And so this is an evidence-based program that helps people stay healthy, strong, and independent. If her health insurance costs go up on ACA, Cheryl likely will not be able to continue to serve this community of people suffering from Parkinson's disease. And she says that we've created a supportive community to reduce isolation and depression among those living with Parkinson's and the people that support them. This is the fastest growing neurological disease in the country. If prices for the ACA go up 75%, I will have to make some very hard decisions. Please, please, please hold the line and encourage those around you to continue fighting for the healthcare of the people. Here's another one from a constituent of mine in Gaithersburg, Maryland. She says, as a participant in the ACA, we pay $24,000 a year for health and dental insurance for our family of four. We will not be able to afford insurance for our family if you do not hold the line on the issue of Medicaid and ACA tax incentives. Now is the time for political courage, she writes. Please do not compromise with fascists or those who seek to erode our freedoms. I am counting on you to defend our democracy and uphold your oath to the Constitution. So this is, we're in the fight of our lives here. This is a critical moment for American democracy. We don't have national health care the way that Canada does or most of the advanced civilized industrial countries do. But we've been able to patch together a system that's working for a lot of people, and they want to pull the plug on health care for millions of people. And we've got to hang tough and stand strong. So thank you for doing this, and I'm happy to yield back, Madam Chair.
Raskin, and now I don't know between the two freshmen that are on this panel. I don't. You can choose, but we'll go with.
We can go by their birthdays, maybe.
Congresswoman Randall of Washington State.
Thank you so much, Madam Chair, for convening this space for us to hear about the impacts on our neighbors. It's clear that we are here doing the work. We're here ready to do our jobs, ready to negotiate, to work with colleagues from across the country and across the aisle to reopen government and serve our neighbors. But for the second week in a row, Speaker Johnson and Republicans have canceled votes to remain on vacation while American families are facing an unprecedented healthcare crisis. Instead of working across the aisle to lower costs for families in our communities, President Trump and Republican leaders chose to shut down the government. And I say chose because it is an active choice. They had months, as you have heard from panelists, thanks to the ACA's premium tax credits, she can afford this healthcare coverage. She's a small business owner, an independent provider, and she buys her healthcare on the ACA. But losing this benefit would push her insurance costs to nearly $3,000 a month. And the average mental health care provider makes about $60,000 a year. So $3,000 a month is solidly more than half of her take home pay, leaving her just an average of $2,000 a month to pay for rent, to pay for food, to pay for all her other necessities. Other constituents with stories like these said, I wasn't able to afford health insurance until the tax credits. Please do not take this away. One of my neighbors said, I will either die from working too many hours to afford my health care, or I will die from heart disease. And another, without the enhanced premium tax credits, I wouldn't be able to afford my HIV treatment. These subsidies are literally keeping me alive. These stories make it clear that we cannot let political games put lives at risk. It's time for Republicans to come to the negotiating table and work with Democrats to open the government and protect these ACA subsidies that keep our community alive and healthy. Thank you. Do I turn it off or not? I don't know.
Kendall? Sorry, we're doing musical chairs up here with members coming and going. Congresswoman Morrison from Minnesota.
Thank you, Madam Chair, and thank you for holding this hearing and for giving the people of Minnesota's 3rd District the opportunity to participate, 3rd District that I proudly represent. Prior to my service later, I had the privilege of caring for patients as an OBGYN for more than 20 years. And I can tell you as a physician, I am truly afraid for my patients and for my colleagues to take care of them. The Republican policies of gutting Medicaid and now threatening to not extend the ACA premium tax credits that have made it possible for millions of Americans to access health care will cause tens of millions of Americans to lose their health insurance. Such a drastic increase in uninsured Americans will have dire consequences for clinics and hospitals already struggling to stay above water. In Minnesota, we are proud to offer the kind of care that people travel from neighboring states multiple hours, and in some cases, hundreds of miles to access. It's the kind of care the community, the state, and quite frankly, the Midwest region of the United States simply cannot afford to lose. But Republicans have put the desperately needed care these facilities provide in serious danger. A salient example in Minnesota is HCMC, a safety net hospital, level 1 trauma center, and a lifeline for the upper Midwest that runs the busiest emergency room in the state of Minnesota and trains the physicians we count on in moments of crisis, the literal future of our physician workforce. And I might add, the hospital that took care of many of the children who were shot in the Annunciation Catholic school shooting. It's safety net hospitals like HCMC that are strained even further under the circumstances Republicans have manufactured. Facilities will be forced to choose what service lines they have to cut, what workers must be let go, what patients will be forced to go elsewhere for care that will no longer be available. Failing to extend ACA premium tax credits and allowing devastating Medicaid cuts means those patients and patients of hundreds of physicians in this country will suffer because Republicans refuse to act. When a person or a family is without health insurance, it hurts their health in the short and the long term. You delay care. You postpone your appointments. You wait until you need emergency care. You give up the medications that were helping to keep your chronic condition from becoming life-threatening. Your child misses the vaccine that could have prevented a hospital stay, or worse. You miss the routine screening that could have caught the cancer early. Investments in preventative care save lives and save taxpayer dollars. Safety net hospitals and their workforces struggle when a community is made sicker by delays in care and growing numbers of people without coverage. Republicans are protecting billionaire tax cuts over the health of low and middle income families on the American taxpayers' dime and on the backs of healthcare workers across the country. And while all of that is more than enough reason to reverse that crisis, an analysis of the Republican health plan estimated over 50,000 preventable deaths as a direct result of the path Republicans have put us on. So Republicans are holding the government hostage at the expense of American lives. They've spent the last 8 months putting our vulnerable healthcare system on a fast track to disaster. They pushed almost $1 trillion in cuts to critical health programs, endangering countless clinics and hospitals, many in their own districts, to deliver tax cuts that benefit primarily billionaires. Now they're demanding we support a plan that will result in millions of Americans paying hundreds more a month for health insurance, thousands more in many cases to make the grim decision to live without coverage. Over half of the Americans at risk for the highest impact live in districts they represent. But my Republican colleagues are out of town with no urgency to act. It's unconscionable to me as a physician and should be absolutely disqualifying for the legislators failing to protect the health and well-being of the Americans they were elected to represent. With that, Madam Chair, I yield back.
To our panelists, thanks for coming to work today, unlike some of our friends who chose to not be here and get the people's work done. As we make a transition to the next panel will include Representative Jasmine Crockett of Texas, Representative Morgan McGarvey of Kentucky, and Representative Susan Delbene of Washington State. We're going to proceed in order of seniority. So Representative Delbene, you are recognized.
Thank you, Madam Chair, and thank you to the committee for holding this important hearing. Let's just start with the facts from my home state in Washington. Nearly 200,000 individuals will lose Medicaid coverage because of the big ugly bill Republicans passed. 80,000 individuals will be priced out of ACA marketplace coverage without the extension of the premium tax credits. And for those that are able to keep their ACA coverage, they're going to see their premiums go up by an average of $1,300 a year. And that's the average. Older adults in my state between the ages of 55 and 64 are expected to see their marketplace premiums increase by over $1,900 next year. Trump promised to bring down prices, and he broke that promise.
Groceries, healthcare, energy costs have all gotten more expensive. Trump's tariffs alone are costing the average family $2,300 this year. And if we don't extend these enhanced premium tax credits, families will be paying even more. Instead of lowering prices, Trump cut programs like Medicaid and SNAP, triggered $500 billion in cuts to Medicare, and increased the deficit by $4 trillion, all to give tax breaks to the wealthiest in our country. And now Trump and congressional Republicans won't come to the negotiating table to ensure that healthcare costs don't skyrocket next year. Democrats are here. We're right here. We're House Republicans. I've spoken about these issues numerous times, and I want to spend some of my time today making sure we hear from the folks that directly impacts. Here, right here, a collection of stories of people in Washington who are worried about losing their health care coverage without the extension of the tax credits. In here are stories of young professionals, parents, cancer survivors, business owners, and retirees who have coverage on the exchange so they can take care of themselves, their families, and their businesses. These are everyday Americans who just want to ensure they can go to the doctor next year if they need to. And it's not just those who get coverage through the ACA or Medicaid who should be worried. Our providers and health systems have been sounding the alarm. They know that these cost increases eventually are going to impact everyone. Cassie Sauer, the CEO of the Washington State Hospital Association, shared that, and I quote, "Choosing not to extend the enhanced premium tax credits will only make it harder to sustain local healthcare services. People who can't afford the increased premiums will still need healthcare. Hospitals will be left covering the cost of their care at a time when they are already struggling and bracing for the impact of the cuts imposed by H.R. 1, end quote. I've also been in contact with the Washington's State Insurance Commissioner, Patty Kuderer, and she said, quote, "Washington State has made tremendous progress in lowering our uninsured rate to 5%. The ACA marketplace is our most vulnerable market, where approximately 300,000 Washingtonians get their health insurance, and most receive a tax credit to help them afford coverage. Anything other than a straight extension will cause further delay and chaos in the market. I urge you to stop playing political games with people's healthcare and extend the enhanced premium tax credits as soon as possible," end quote. We are here fighting for our communities. We're Republicans. We need folks who are going to represent their communities, come to the table, and make sure we're protecting our healthcare. Thank you.
Thank you so much, Congresswoman Del Bene. Next, I'd recognize Congresswoman Jasmine Crockett of Texas.
Thank you so much, Madam Chair. They continue to say, trust us. These tax credits won't expire until December. Just trust us. We will negotiate. Well, I have news for our colleagues across the aisle. Trust must be earned. It is not given. You see, President Trump swore in on January 20th, and since then, congressional Republicans have perpetuated an economic war on Americans. They asked us to trust them on the price of eggs, yet they've made it harder for Americans to buy any and all groceries. They asked us to trust them when it came to the cost of housing, but it's become more difficult to pay your rent or mortgage. They asked us to trust them when it came down to looking out for the best interest of our children. Yet we know that the cost to send your child to daycare or college has only increased. The only thing that I can tell you that we should trust the Republicans to do is to basically play in our faces. You see, the one thing that we should do is distrust everything that they say, and that is why Democrats are here today fighting. We showed up to work because we understand that in this shutdown, we are still getting paid. Unfortunately, those that work for the federal government are not going to be paid. They are about to miss their first checks. And so it is so interesting that someone can say, we're not going to show up to work. We're not going to do everything that we can to reopen the government. But yes, you must show up. What I have to say to those hardworking federal employees and those that happen to be out sick right now is that I anticipate that a lot of people are going to catch a lot of colds in the coming days, because it seems like the only thing that these people will understand is if we have a real shutdown, a shutdown in which the people that actually make this country go start acting like the Republicans, and they just decide that they're also not going to show up, because at the end of the day, we have a president who recently said that he doesn't know whether or not he even wants to pay people when we do reopen this government. In just 8 months, Republicans have shattered an already broken public health system. Their one big ugly bill enacted the largest cuts to healthcare in American history. Texas, under Republican rule for over 30 years, already had the highest uninsured rate in the country. And now an additional 1.6 million Texans are projected to lose their health insurance. But I want to be clear about this. This isn't just about those that will lose health insurance, because at the end of the day, we all will be impacted. Everyone's healthcare costs will go up, and everyone may end up missing a hospital or a doctor because of the reckless policies of the Republicans. Just in my district, a 60-year-old couple making $80,000 a year would see their premiums increase by nearly $20,000. A family of four making $64,000 a year would see an increase of $2,571, roughly 197%. Stripping away healthcare is just one aspect of their economic and healthcare assault on Americans. They've eliminated critical funding for local health departments and community organizations doing critical public health work. So we're here today because Republicans have once again chosen to prioritize billionaires and corporations over everyday Americans. Veterans, teachers, students, law enforcement officers, members of the military, factory workers, bus drivers, all of whom will be hurt by Republican healthcare assault on Americans. I'm here today to speak for the 90,000 people in my district who will see an increase in their healthcare cost, and the millions of Texans who could lose their coverage if we don't extend the tax credits. And I wish that Republicans would put as much energy into doing their jobs and protecting healthcare of their constituents as they do into protecting Jeffrey Epstein and Ghislaine Maxwell. Maya Angelou said, "When they show you who they are, believe them the first time." The final point that I'll make is that some people in this building know that I have a best friend by the name of Marjorie Taylor Greene. She even recently stated, "I'm going to go against everyone on this issue because when the tax credits expire this year, my own adult children's insurance premiums for 2026 are going to double." Now, the fact that Marjorie and I agree on anything tells you how bad this is. America, it is time to call your representatives, your Republican representatives, and tell them to show up and do their jobs. Thank you, and I will yield.
Thank you.
They're saying they don't care if your health insurance goes up. They're saying they don't care about you. We're all hearing stories from all over our communities. And literally right before I walked down here today, I was speaking with a woman from Louisville, Kentucky named Ann. Ann's a small business owner. She's a real estate appraiser. She has a second part-time job to help make ends meet. She's married. Her husband's an independent contractor. And together they have a 19-year-old son who's disabled. He's had 14 surgeries at this point in his life. He sees a half a dozen specialists several times a year still, but he goes to the University of Louisville where he's a student and he lives at home. And how is Ann able to do all of this and make this work? It's because as a middle-aged small business owner who has an autoimmune disease and asthma, she has health insurance. And she has health insurance because of the Affordable Care Act. Now, is that health insurance cheap or free? No. In fact, Ann has a silver plan right now where she pays $350 a month. But it's $350 a month because there are tax credits. Without those tax credits, Ann's health insurance would be $1,275.69 per month. As she told me today on the phone, that is more than her mortgage. What does she do? She already owns her own business. She already has a second job. She has a disabled son who is able to go to college. She is terrified of what's going to happen, scared to death. She literally told me, I don't sleep. I lose my breath just thinking about it. Because while the Republicans pretend that there's no urgency to this right now, Ann and her family are making the decision of whether or not they're going to have health care next year. Open enrollment's happening now. She has to choose. She's on the silver level plan, not the gold level plan, not the platinum level plan. She's on the silver level plan. She doesn't know how much that's going to cost next year. She doesn't know how much any plan is going to cost next year because the Republicans in Congress refuse to act. They refuse to act to bring down the cost of health insurance, to make it possible for people to start their own business, to make it possible for people to live their dreams. You know what? To make it possible for when life isn't perfect, to make ends meet and know that you can go to the doctor. So what's Ann doing right now? She's going to as many doctor's appointments as she possibly can. She is going to her doctors and asking if they have extra samples so she can stock up on medicine because next year she doesn't know if she's going to be able to go to the doctor. Like so many people across this country, when people don't have health insurance they can't afford, when they can't afford their health insurance, what's going to happen? They're going to stop going to the doctor. They're going to stop getting the preventative care. But guess what? That's not going to stop people from getting sick. And when people get sick, they're going to go to the emergency room, and that care is going to be more expensive. And it is going to be borne out by everybody. As Ann told me, she said, if I don't have health care, I won't go to the doctor. I won't get regular care. I will end up in the ER. And if you want to be cold, callous, and mean, it just costs less for you to let me have preventative care. And then she said, and I think this is the point, if you just want to be a total jerk and look at the bottom line, then actually passing these tax credits is cheaper than not passing these tax credits. So where are the Republicans? They know this is important. They know it's urgent because when Donald Trump passed tax cuts for billionaires in 2017 that were going to expire at the end of this year, they made sure to extend and expand those, calling us back in over the 4th of July to make sure it was done. Now that people's health insurance is on the table now, they are nowhere to be found. They've got to come back to Washington. They've got to work with us to open the government back up and to lower the cost of healthcare for the American people. I yield back.
Thank you very much to all of our panelists, and thank you for helping us remind the American people that we are here working and the Republicans have not shown up to work. Our next panel should make their way to the table. That includes Representative Johanna Hayes of Connecticut, Representative Yasmin Ansari of Arizona, and Representative Jimmy Panetta of California. In order of seniority, we will begin with Representative Panetta of California.
Thank you, Representative Wasserman Schultz, and thanks to all of my colleagues and of course Leader Jeffries for ensuring that we get this opportunity to talk about not just where the Republicans are, but what we need to do as a Congress, what we need to do as a body, what needs to be done for our constituents, not just in my district on the Central Coast of California, but all across this country. Now, in my limited time as the U.S. representative, I've continued to hear from my constituents, be it workers, retirees, disabled neighbors, injured loved ones, Medicare recipients, Medicaid beneficiaries, and everyone in between, that no matter how they get their health care, it's harder and harder and harder to come by and to sustain even basic health care. That's why I have repeatedly called for us to invest in our healthcare system by reforming Medicare and building on the foundation of the Affordable Care Act. Nobody in this country should have to go without healthcare or to struggle to find an appointment or watch one of the last hospitals in their county close its doors. But unfortunately, the one big bill that's signed into law by the president in July does the exact opposite to help those types of people. In California, the California Medical Association estimates that California will lose $226 billion in health funding as a result of this bill. The California Hospital Association estimates that in the 19th congressional district alone, there will be as much as $900 million in hospital cuts, $128 billion statewide. And every single provider I talk to, from community healthcare centers to trauma centers, the local hospitals, are absolutely terrified as to what these cuts will mean for every single patient when our doctors are forced to close their doors. I think we all understand this affects everybody. This is not an abstract concept or a far-off threat. Providers in California, 19th Congressional District, are already cutting services. Beginning in January, 33,000 of my constituents will see their health care costs go up. By letting the tax credits expire, walking away from this crisis is simply not an option. We're basically abandoning constituents, our neighbors, our parents with spiraling health costs, middle-class families with children, hardworking people who did everything right but still find themselves sitting in the hospital with a sick kid or that unthinkable diagnosis that's just simply not an option. That's why we're here today. We're here because we are urging our Republican leadership in the House, in the Senate, and yes, even in the White House, to do something we've done in my limited time in Congress. Something not too abstract. Let's just negotiate. In my limited time, I've been through 29 continuing resolutions. I'm not proud that we've had to have these continuing resolutions, but I am proud that each of those CRs were a result of negotiations, direct negotiations, Democrats and Republicans sitting at the table. And you bet we have a lot to negotiate. And I want to harken back to what Representative Crockett said about trust. What you hear Speaker continuing to talk about is, well, we have till December to negotiate. You should trust us that we should negotiate. How can we trust a Republican leadership that has the cuts that they do and voted on them in the OBB? How do we trust a Republican leadership who allows its administration to make the impoundments that they've made? How do we trust a Republican leadership that makes rescissions to agreed upon spending bills? This trust comes about through these negotiations. That's why we should be here, because we need to do our part to make sure everybody comes to the table to negotiate so that we can protect healthcare, so that we can reopen up the government, so that we can reduce our costs. I think it's clear we're on the right side of this, and this is something where we need to make sure that constituents, not just in the 19th Congressional District, but constituents throughout the country, especially those in Republican districts, make sure they hold their representatives accountable, make sure they get them to the table so that we can negotiate, open up our government, and protect healthcare. Thank you, Madam Chair. I yield back.
Thank you, Congressman Panetta. Next is Congresswoman Johanna Hayes of Connecticut.
And thank you to all my colleagues for being here today, for showing up to work, just like the rest of the American people. On October 1st, as we all know, the federal government ran out of money and we went into a shutdown. My office has been open every day since then, both in the district and here in DC. And along with my staff, I have answered the phones, I have received emails, we have listened to voicemails. And overwhelmingly, people understand what it is that is happening right now. They understand the work that Democrats are trying to do to protect their health care. But there's also a sense of fear in their voices as they're telling the stories, trying to make the case, trying to help me understand. And I have to assure them that as Democrats, we do understand. And just so that we're clear, I'm hearing from people who are doing the best they can, showing up for work every day, small business owners, independent contractors, working people who have to purchase insurance through the marketplace. A couple in Danbury with an income of $88,000. They're working every day. They pay $613 currently for their health care. Their costs are expected to jump to $4,193 a month, from $600 to $4,000 a month. an increase of over $42,000 a year. And it's not just them. A couple in New Britain with around the same income making pays now $607, their premiums will increase to $4,286, an increase for the year of $44,000. That's half of their annual income. These are people who are already showing up to work, who are already doing everything that they're supposed to do. Last week, the Connecticut delegation did an event with Access Health CT. That is our official Connecticut marketplace. And the numbers were staggering. About 34,000 people in Connecticut will lose health coverage. About 23,000 of those people will see their costs rise. And about 108,000 people who currently receive access to nutrition programs will see those benefits jeopardized. This doesn't have to happen like this. It doesn't have to happen like this. September 19th was the last time the House was in session to vote. The last time Speaker Johnson had us here. He has canceled votes every day since then. October 17th is the day that Access Health CT will start sending out these premium notices to these people. And just the anticipation of those letters coming in the mail has already instilled fear in my constituents. But I will say the majority of callers understand how important it is to protect healthcare, and they want us to keep working to do that. My governor announced plans to try to backfill some of the programs that are being cut, to try to inject money into the WIC program to make sure our babies are fed, to help stabilize SNAP for a couple more weeks, to make sure our seniors and people who rely on these nutrition assistance programs get the care and the help that they need. But no state, not Connecticut, not any state, has the money to fill all of these gaps that are happening. LIHEAP programs in a state like Connecticut where winter is coming. All of the things that people rely upon. And I will say that I am here. I am ready to work. I am ready to negotiate and do whatever we need to get our Republican colleagues back to the table so that we can work out a deal. But I also recognize that we are not dealing with reliable legislating partners. So we have to make sure that we have concrete deals. We have to make sure that OMB can't take another $8 billion in appropriated funds and send it elsewhere. We have to make sure that projects do not fall silent and work sites end because they've taken the money. We have a president right now who's saying he's not sure if furloughed workers will be paid. This is legislation that he signed into law. And now he's saying he doesn't really know if that was the interpretation of it. This is an orchestrated effort to pressure not only Democrats, but the American people into accepting something that they know will be bad for them in the future. I am so proud to stand with House Democrats on behalf of not only my constituents in Connecticut's 5th Congressional District, but all across the country who understand that we are fighting for their care, that we are trying to lower the cost and cancel these cuts that are hurting them every single day. It would be different if we were talking about healthcare in a vacuum, but people are seeing costs rise everywhere. Housing, insurance, food, everything is rising. And we are the party that are standing up for people and not transferring wealth, trillions of dollars, to the wealthiest individuals in this country. I hope that my Republican colleagues are watching this, are hearing these stories from their constituents as well, are really understanding that we need to get back to the table and get back to work for the American people. I'm here. I was here last week. I'm here today. I'll be here next week. We're ready. So as soon as Mike Johnson gavels us in, Democrats are ready to do the work. And thank you again for convening this hearing today, and I yield back.
Thank you, Congresswoman Hayes. Congresswoman Ansari of Arizona.
Hello? Okay. Thank you so much. The debate over renewing and strengthening the Affordable Care Act's tax credits and protecting healthcare access more broadly isn't just about abstract numbers or partisan talking points. It's about people like Jennifer Dunn, a mother from Phoenix in my district, who embodies both the struggle and the courage of so many Arizonans. When Jennifer's second child, Atticus, was born 16 weeks premature, he weighed just 21 ounces. His skin was so translucent that the nurses could see his kidneys through it. Atticus spent 165 days in the neonatal intensive care unit before finally coming home. Now, at just 2 years old, he lives with cerebral palsy, a visual impairment, and developmental delays. Jennifer is also caring for another child with disabilities. She's unable to work because she's a full-time caregiver to her boys. Without Medicaid, her family's medical bills would have bankrupted them. Earlier this year, Jennifer traveled all the way from Arizona to share her story with Washington lawmakers. While she was here, she got a message that Atticus had stood up for the very first time. She said, "It's like he knew I was in DC, standing up for him, and he wanted to stand up for me." That's the kind of determination and hope that defines Arizona families. But if we fail to renegotiate and extend the Affordable Care Act's enhanced tax credits and allow cuts to Medicaid to take effect, families like Jennifer's will face impossible decisions. They'll be forced to choose between healthcare and groceries, between their child's therapy and their mortgage, between life-saving surgery and keeping a roof over their heads. Let's be clear, the Affordable Care Act's enhanced credits have made a life-changing difference for millions and millions of Americans. Nearly 230,000 Arizonans gained or kept their health coverage because of them. These are working families, small business owners, caregivers, and retirees, not just statistics. And if these credits expire, their premiums could double or worse next year. Many more could lose coverage altogether. And this isn't about political wins or losses. It's about doing what's best for our constituents. Something that the late senator from my state, Arizona, Senator John McCain, understood when he stood up to protect the Affordable Care Act years ago. He knew that healthcare is not a partisan luxury, it is a basic necessity. So I say to my Republican colleagues, let's follow that example. Let's actually negotiate and do our jobs, which is to serve our constituents. Let's protect the healthcare lifelines that millions of Americans rely on. Because Jennifer and Atticus and every family like theirs are counting on us to stand up for them, just as they have stood up for what's right. Thank you.
Thank you so much to each of our panelists for putting a real human face on this crisis that is manufactured and unnecessary by our Republican colleagues. Thank you so much. Next up are our panelists, Congressman Frank Pallone of New Jersey, Congresswoman Andrea Salinas of Oregon, and Congresswoman Chrissy Houlihan of Pennsylvania.
Do you want me to start, Madam Chair?
Yes, please.
Okay. First of all, I really want to stress this fact that the Republicans are missing in action. You know, I've been here for a long time, and I been through a lot of shutdowns, but I do not remember any shutdown where the members of the House of Representatives or the Senate didn't stay here in Washington Saturday, Sunday, the whole time until we had figured out on a bipartisan way how to end the shutdown. And the fact that that the House Speaker canceled votes last week, canceled votes this week, so that we don't even have the opportunity to be here in session to vote on some negotiated bipartisan agreement to end this crisis is an outrage. It is totally an outrage. And for those who are suggesting that somehow there's no reason for us to be here because we can just vote on one proposal versus another is not an excuse. It is certainly not an excuse. The other thing too that I see is that our Republican colleagues in the House won't acknowledge that there is a healthcare crisis. When I say to them, "Oh, there's a crisis," they deny that it even exists. They refuse to show up to fix it. They say it doesn't exist, and they don't see the urgency of it. Well, let me tell you that we don't have any time, right? I mean, already in many states, they have put out the filings and indicated to the public what the next premiums are going to be without the help from the federal government that comes from the subsidies or the tax credits. What I'm hearing from my colleagues on the Republican side on the Energy and Commerce Committee, where I'm the ranking member, they say, well, we never supported the Affordable Care Act from the beginning. We never supported the enhanced premium tax credits. So why would you expect that we would care? Why would you expect that this matters to us? Now, I understand they didn't support it. I was one of the drafters of the Affordable Care Act when I was the chairman of the Health Subcommittee of Energy and Commerce at the time. I understand they didn't support it. I understand that they tried to repeal it. I understand that they didn't vote for the enhanced premium tax credits. But for them to not understand why that's important, and having been, through COVID and so many crises, and realizing that healthcare premiums keep going up, the deductibles, the copays keep going up, and that this is a crisis, you have to be an ostrich. You have to have your head in the sand. You couldn't possibly not understand that or not care. But this is what we're hearing from them right now. November 1st, a lot of the filings are already out. November 1st is when the open enrollment begins for the marketplace, for the Obamacare or the ACA marketplace. So within the next few weeks, people are going to have to make a decisions whether or not they're, buy the insurance or not. And it's probably about 25 million Americans are going to face the sticker shock or the skyrocketing monthly premiums that come from the fact that they're not providing or not helping provide any, these extra tax credits that make a difference. Now, I just want to give you an example. I'm going to so many, and I've been here sitting here with you for a while, and I've heard some examples, but I wanted to just use one example of a 60-year-old couple making $85,000 a year in Fulton County, Georgia, that'll face a increase of more than $2,000 per month in January. You're making $85,000 a year, and you're going to buy insurance that is going to cost you $2,000 more per month. You're not going to do that. You're just going to go without the insurance. And what happens when you go without insurance? The costs for everybody else go up, right? You don't have insurance. You have you go to the hospital, uncompensated care. The hospital then doesn't have that money coming in. So they're going to increase premiums for everybody. This isn't just for people who are get their insurance through the marketplace. This includes those 65% of the public that get their insurance through the job, because all those providers, whether it's the doctor, whether it's the hospital, whether it's a nursing home, they're all going to have to spread those costs to people that have insurance through their jobs, right? And that could go up 10%, 20%, who knows, because of the uncompensated care. And then the next thing's going to happen. A lot of those employers are going to say, well, I can't afford to buy the health insurance for my employees anymore. Or I'm going to buy a policy that's catastrophic, that doesn't cover anything, or increases the deductible, or increases the copays. So, some people are saying, well, what does it matter? This only applies to the people, that buy their insurance through Obamacare. Most people get their insurance through the job. That is another false narrative. That is another lie that is being put out by the Republicans, because everybody is impacted by this. And you understand that this crisis has been aggravated by the fact that when they passed their big, ugly bill, or big, beautiful bill, whatever they said, right? Not only did they not provide for the enhanced premium tax credits that we're now talking about, but they also cut Medicaid by $1 trillion. And the result of it is there's also going to be cuts to Medicare by 4% across the board because of the sequestration. I don't like to use that term with my constituents, but you know what I'm talking about, right? Mm-hmm. That's another $500 billion. Right. And all these things have created a crisis. But beyond that, this administration has created a healthcare crisis that goes even beyond Medicare, Medicaid, and health insurance in general, because you have a Secretary of Health and Human Services, Robert Kennedy Jr., who's telling people they don't need vaccines or making it more difficult for them to get vaccines. I had people calling me at my district office asking me whether they should take Tylenol. I mean, I've been dealing with healthcare for a long time, but I'm not a physician. I'm not going to tell them whether they should take Tylenol, but they have created all this chaos, not only with health insurance and vaccines, with what kind of medication you should take. It is just unbelievable. And the other thing is the shutdown. And that's the last thing I'm going to mention is that this shutdown aggravates all of that as well. They're like, you understand this. Some of these community health centers, other places that rely on funding diabetes programs, teaching health centers, telehealth, all of these are depending on federal dollars. And some of them keep going now because they have a little more money for another week or two. But this Republican shutdown is also aggravating the Republican healthcare crisis because these places are going to run out of money. And then what happens then? More uncompensated care, more people go into the emergency room. And as a result, premiums go up again, even for people in the private sector. So it is totally irresponsible for them to say that there's not a healthcare crisis, that people do not need the help of the federal government to pay for the health insurance on their ACA. It's time for the Republicans to get back to work. Come down here and meet with us. We're here, they're not. I think that shows a lot about the fact that we care and they don't. And thank you for having this hearing.
Thank you so much, Congressman Pallone. Congresswoman Chrissy Houlihan of Pennsylvania.
Thank you so much for the opportunity to speak in front of the committee today. My name is Representative Chrissy Houlihan, and I serve Pennsylvania's 6th Congressional District, which is just outside of Philadelphia. And it's not that far. In fact, I left home this morning at about 5 a.m. to be able to come down here and intend to be here for the remainder of the week, and I'll be here next week as well. For 8 days now, we have invited President Donald Trump and Speaker Mike Johnson to work with us to forge bipartisan deals that will reopen our government and will lower the cost of health care for millions. But where are the House Republicans? When you walk around the halls, they are nowhere to be found, and it's apparent that they are on an extended vacation. Where I have had a town hall and 4 different roundtables over the last 2 days, I'm not certain that any of our Republican colleagues are doing anything to advance our government or the people that they represent. I am one of the most bipartisan members of Congress. I'm on the Problem Solvers. I'm part of a group called For Country, which is all about people who've worn the uniform. I'm the co-chair of the Bipartisan Climate Caucus, the Bipartisan Biotech co-chair and founder. I'm the Bipartisan STEM and STEAM co-founder. I am the Bipartisan Service Member co-founder. You would have to look very hard to find somebody who's less or who's more bipartisan than I am. And I stand here willing, as usual, to work with any Republican who wants to do the right thing and to protect access to health care. I come from one of the most bipartisan communities in Congress. My district is 40% Republican, 40% Democrat, and 20% independent. And let me read to you the top 3 and 4 reasons why people have been calling my office during this shutdown. Number 1, they're worried about the end of the ACA tax benefits. Number 2, the deployment of U.S. troops. Number 3, the behavior of ICE. That's how emails are, the top 3. On voicemails, number 1, the fear of losing their affordable health care. Number 2, the deployment of our guard to cities, American cities. And number 3, to please swear in Representative Gahalva so that we can have a vote on the Epstein files. From my community of 40% Republican, 40% Democrat, and 20% independent, those are the top 3 reasons that people are calling my office. You notice that not one of them says bend and open the government again. Not one of the top 3 reasons. So again, I ask, where are my Republican colleagues? Surely the silence from them is deafening. And the result is that, as you've seen, people from southeastern Pennsylvania, both Democrats and Republicans, are scared. They're scared that they may be one of the tens of thousands of people who will see their health care costs rise because of the Republican budget, known as One Big Beautiful Bill. They're scared that over 19,000 people will lose health care coverage because of the Republican cuts to Medicaid and the Republican refusal to extend the health care tax credit. And let me be clear, this is a problem of their making. We all want the government to open and to be functioning, but we cannot walk away from healthcare for 24 million Americans. And in my district, I hear consistently that life is very unaffordable, how costs are too high and healthcare is out of reach. And we've seen firsthand what happens when inflation and a lack of access to care can meet. We've faced 3 hospital closures in my community alone already. We've seen too many healthcare systems struggle with rising costs, low in reimbursement, and provider shortages. And here is where I believe that we must hold the line. because there's too much at stake for too many. If Republicans don't join us, join me, and act now, my community will certainly suffer, and so will theirs. Illness doesn't affect just one party. If you're diagnosed with breast cancer, it doesn't matter if you're a Republican or a Democrat or an independent. If a family member needs insulin, no one cares who you voted for. What unites us as Americans is that we all know someone who will face health challenges or may in fact be facing them ourselves. So I implore my colleagues across the aisle, please remember that. Please come and join us here in Washington. I remain willing to meet anywhere and anytime to negotiate a bipartisan government funding agreement that will protect people's health. Thank you so much for the chance to address the committee, and I yield.
Thank you, Congresswoman Houlihan. Congresswoman Andrea Salinas of Oregon.
Thank you, Chair Wasserman Schultz, and to the committee for the opportunity today. So President Trump and congressional Republicans refuse to cancel the healthcare cuts to millions of Americans, including the 16,000 in my district who are about to pay hundreds, if not thousands of dollars more per month for their health insurance. And similar to Representative Houlihan, my district is about a third urban, a third suburban, and a third rural. And this is important because about 27% of farmers across the United States get their health care through the Affordable Care Act. And so I see this as one of the biggest betrayals to Americans' rural communities. I recently sent out a survey to my constituents, and I'd like to share just a couple of the stories. First is a story from Steve, who lives in with his wife in Beaverton, Oregon. Steve is 68 and still working. He's on Medicare. His wife, however, is only 61, and she won't qualify for Medicare for a few years. She currently pays $500 a month for coverage through the Affordable Care Act, but next year her premium is set to increase to $800 per month unless Congress acts. In his response, Steve notes that his wife is a waitress at a small locally owned restaurant. So an additional $300 per month is just simply too much on top of what they already pay for her health care. They likely won't be able to absorb that additional $3,600 a year in healthcare costs, and they will likely just not renew her health insurance and be forced to go without it. Another one of my constituents, Connie, responded with a similar story. She's from a place called Dallas. It's a small rural town in my district, and she has a bronze Affordable Care Act plan, which means her coverage really only covers serious injuries. Everything else she pays for out of pocket. She recently received a letter, one of those notices in the mail, telling her that her premium is going up. Right now, she pays $423 per month for her healthcare premium. Next year, due to Republicans' refusal to work, not just work with Democrats, but to come to work to extend the premium tax credits, she will pay a staggering $2,273 per month. That's an increase of over $1,800 per month in a small rural town in my district. And I don't know about you, but I don't know many people in my district or in Oregon who can afford that extra $1,800 per month for healthcare. These are just two stories from over what I expect to be about 16,000 people in my district. And obviously, we've been talking about millions more that we are going to see across America who will see their premiums spike unless Congress acts. I'm truly worried about Connie and Steve and his wife. I'm worried about all these people who will be impacted in my district and across the United States, and so many more. I don't know how they'll get the care they need if their costs go up next year. I don't know how we will be impacted in our rural healthcare clinics, in our senior living facilities. I don't know how we are going to help them, but I know how we can stop it from happening. Republicans can come back to the negotiating table. They can cancel their cuts to healthcare, extend the premium tax credits, lower costs for families, save healthcare, help Oregonians, reopen the government. Let's start there.
Thank you all so much.
Thank you. I yield back.
Thank you very much. Thank you for sharing those very personal stories. Just another example of how important it is that we underscore the real impact on real people, which is going to cause real pain. Thank you to our panelists as they may make their way out. I'll call upon Congresswoman Hillary Scholten, Congresswoman Melanie Stansberry, and Congressman Don Beyer to the table. And as soon as you get settled, you are recognized.
Thank you so much, Madam Chair. And I want to thank the Steering and Policy Committee for convening this meeting, although I would much rather be on the floor of the House voting on some sort of new deal regarding healthcare. I just think that where we are is sort of unsustainable. People always ask me, how is this, what impact is all of this having on your constituents? And as I listen to people come up with different numbers, so, my constituent is going to be impacted this way or that way. I just want to clarify for the record that we are all in a panic because what we don't know is how much people's healthcare premiums will go up in individual states and different situations. But what we know is that everybody's healthcare premiums are going to go up. That's what we know. And to the extent that people have to add additional healthcare costs to their already strained budgets, with the rent being too damn high, and with the inflation from the cost of groceries, the last thing that they can afford is their healthcare premiums to go up. I hail from the state of Wisconsin, a state that did not expand the Affordable Care Act. And so my numbers may sound a little bit different from what other people's numbers are. But I just have stories from some constituents who have called our office and they're very concerned. One of the things that the Affordable Care Act did is that it broke the job lock that people were in. People were unable to move to a different job and they were unable to become entrepreneurs. So if you're that photographer out there who's working for J.C. Penney and you decided that you were just good enough to go out on your own and to do the bar mitzvahs and the bat mitzvahs and the weddings on your own, the one thing that you couldn't afford was health care. And the ACA enabled you to be able to do that. So Jeffrey from Milwaukee, he says he's self-employed and he completely counts on these credits in order to afford his health insurance. And without that, he would be uninsured. The anxiety that I and I am sure others are feeling is the same. So that is the signature feeling that people have as we have insurance companies about to send out as we speak their letters announcing the premium increases. The anxiety that Jeffrey, as an example, is being felt. Another person from Milwaukee, Erica, she retired this year, and she was using the Affordable Care Act for her and her college-age daughter. She benefited from the ACA credits, and the credits allowed her to afford the insurance. Because of her income, she did not have to pay a monthly premium, but she and her daughter both had a $6,700 deductible based on their plan. Should the subsidies end, she'll be responsible for $1,000 for herself a month and $1,000 a month for her daughter, and still subjected to the $6,700 deductible per person. She's 55 years old, 10 more years before she'll be covered by Medicare. And she is just terrified. How will she be able to afford $2,000 a month healthcare premiums going from $0 to $2,400 a year? 24,000, I'm sorry. And she just doesn't have the budget for that. Another person, Robert from Milwaukee, he was on Medicaid. And he was one of the people that heard the pleas and heard the demands that you get up off your lazy butt and go to work or make more money. So he earned just $200 over the poverty level, kicked off Medicaid, and so now he has no health care whatsoever. But He was so lucky that he found a plan on the marketplace that met his needs. He said that he could afford a silver plan because the $900 a month premium was reimbursed through the Affordable Care Act. And now he is saying that he's at risk of not having any health care at all. He is an in-home senior caregiver working part-time so he can take care of his aging parents. These are the calls that I'm getting. Dennis, same thing. In his early 60s. And he says he's staring into a chasm of fear. And he said, for thousands of Americans like me, word for word, the ACA is not a political talking point. It is the wall between a bearable, if difficult, life and complete and financial and medical ruin. I relied on the ACA's marketplace for my health coverage, and the only way I could secure a policy that didn't deny me for my age, that capped my out-of-pocket costs, and that allowed me to maintain my own health. So he said the fear is a cold, suffocating blanket, another constituent whose wife has cancer. So in the interest of time, I just want to submit the rest of my testimony for the record, Madam Chairwoman. But people ask me how my constituents are doing. I have 267,000 constituents at a minimum. That's just at a minimum who are going to lose health care as early as the end of this year because we are not expanding these health care premiums. And I just want to remind the panel, Madam Chair, that the Medicaid cuts of $1 trillion, these were not, as they have been characterized, for lazy incels that are sitting in their basement playing video games and calling up the basement steps, telling mama to bring them some more potato chips. 46% of Medicaid funding is spent on seniors in nursing homes. And that's a mandatory thing that has to be funded. So the other, the other 54% are we're going to face major cuts in terms of allowing people to stay at home to get health care, allowing them to have rides to dialysis. We are really putting people behind the 8 ball. And with that, I would yield back, Madam Chairwoman.
Spoken like a seasoned member of the Ways and Means Committee. Thank you very much, Congresswoman Moore. Congressman Don Beyer from Virginia.
Well, first, Madam Chair and Chair Wasserman Schultz, Chairman Barragan, thank you very much for doing this. I really appreciate it. And everybody who came from all over the country to be here. And I have the great honor of sitting next to Congresswoman Moore on the Ways and Means Committee. It's a great time. And next to Congressman Boyle when he is not otherwise occupied with his leadership of the Budget Committee. And his chair bangs into mine. But I'm so glad you're doing this. I just want to make 5 simple points. But before that, just the overall theme is how morally unacceptable this is. That life, liberty, and the pursuit of happiness are not possible when we don't have health care, when we're sick, when we feel bad, when we die young. And they are undermining the American commitment to our Constitution, to the Declaration of Independence. Point number 1, I held 2 Medicaid roundtables earlier this year. The message that jumped out from both were the parents and the grandparents of children with disabilities, often grown children with disabilities, 22-year-olds, 28-year-olds, who are only able to take care of them because of the Medicaid waiver. Tears, great fear, great anxiety. What's going to happen to these kids when the Medicaid waiver goes away? When you cut $1 trillion out of Medicaid, which is what the Republican bill does, this is inevitable. And it's going to have a really bad impact on all those people that have disabilities, whether they're physical, sensory, or intellectual disabilities. Number 2, with Andrea Salinas, who's just on here, she and I co-chair the Mental Health Caucus, taking over from the wonderful Grace Napolitano. What I'm hearing from the psychiatrists and the psychologists and the MSWs is great fear about what happens with Medicaid, with all the folks with severe mental illness, and just with anxiety and depression, the people who won't be able to go to work. And then point three, that's just the fact, politically, I do not understand what the Republicans are doing. The only reason Donald Trump, well, there's many reasons Donald Trump won, throwing some racism, throwing some misogyny, but the political issue, the policy issue was the cost of living that has skyrocketed during the 4 years of COVID.
Next is Stan.
And so his big
McLean.
promise for the golden age of America and to cut costs, he's not done a single thing this year that would bring those costs down. This is probably the worst. It's even worse than the tariffs in terms of driving costs up. It's going to drive costs up for all those people that are depending on the enhanced premium tax credits, but also for everyone else. Because I'm a member of Congress, I'm on the exchange, Washington, D.C. I don't appreciate the fact that it's age related, but what the hell? It's very expensive for a couple of two. But I don't qualify for the credits, of course, but because of the credits and not doing the premiums, not only will many millions of people lose their health insurance, but the ones who won't sign up again because they can't afford it are typically going to be the healthier ones. And the ones that stay on are going to be 75 years old. And you're going to have what they call adverse selection that you all know about very well. That means the premiums are going to go up for all the people that still are on it. So everyone's premiums are going to go up, whether they got the credits or not. The fourth point, also, I'm just astonished that on the one hand, you have John Thune in the Senate saying, we'll just take care of it later. Others have spoken eloquently about, oh yeah, we can trust them. And then you have the Freedom Caucus and Andy Harris and others saying, let's just get rid of them once and for all. Literally just a commitment to no health insurance. Point four, I spent 46 years running the little family business. I promise you, when I would look at the financial statement every month, one of the things that was the most difficult to deal with was the cost of healthcare. And if you're a good boss, you're paying for the healthcare premiums for your employees. And if not paying for all their families, you're at least subsidizing it. This makes it ever harder for people to be entrepreneurs, to start a business, to grow a business, to survive in this economy. This is the absolute opposite of what you want to do if you want to grow this economy faster. And finally, because none of my Virginia Republican rural friends would show up, let me point out that 3 hospitals have already announced closing in rural Virginia in the Shenandoah Valley. It's going to hit the people that voted for Donald Trump harder than anybody else.
Yep.
And it is a crazy thing politically to do, and why, for people who are supposed to be thinking ahead, would they want to give us the most powerful political message of what they've done to their people in the 2026 elections? If I were a Republican, I'd be begging Thune and Johnson to solve this. I'd actually, like Jasmine Crockett, be endorsing something Marjorie Taylor Greene for the first time in my life, that they need to step up and fix this. And with that, I thank you for doing this. I'm pleased to yield back.
So much, Congressman Beyer. Congresswoman Hillary Scholten of Michigan.
Thank you so much, Madam Chair. Can you all hear me?
Yeah.
Speaking okay? Fantastic. And thank you to my esteemed panelists. I appreciate your remarks and insights so much. Today marks day 8 of this shutdown, 8 days since Republicans brought this government to a grinding halt, all because they refuse to address the affordability of healthcare in this country. We are here, ready to get to work. We were supposed to be voting this week, but the Republicans canceled votes and gave themselves a taxpayer-funded vacation while we continue to work. Our troops are about to miss their first paycheck if we don't get this resolved. Federal workers are working without the certainty of a paycheck. Republicans in Congress will still get paid while this shutdown goes on. And they gave themselves a vacation funded by the taxpayers rather than showing up here to do their work. The deadline to pass a budget, I'm new to Congress, but I'm told it's the same every single year. September 30th, I see heads nodding from our esteemed panelists. This is not a surprise. Is it, Ranking Member DeLauro? We do this every single year, September 30th. We know the deadline. I'm told we're ready to go on our side. We've got our ducks in a row. We know what we want, but they have been disorganized to the detriment of the American people. They're using this moment for political leverage. They had no problem passing tax cuts and making them permanent for billionaires earlier this year, even calling us back from the 4th of July holiday to make sure that those tax cuts for billionaires could get through. But they won't even come to the table to negotiate tax cuts for hardworking middle-class families that would allow them to afford the health care that they need. I've heard a lot of bluster from our Republican colleagues talking about how we should just go along and pass this clean CR so that we can get it done. We're not even going to negotiate over whether this is a clean CR. It cuts $13 billion in non-defense discretionary funding, including almost $280 million to the NIH, on top of what has already been cut. I urge my Republican colleagues to come to my district and talk to family members who have loved ones in clinical trials for rare disease by the NIH and say, sorry, your study was cut. It was a clean CR. What can I tell you? That's not the way this works. It's not a clean CR. The American people are asking us to stand up for affordable health care. I want to share with you the story of some constituents who are directly impacted by this funding. When people ask, can't Democrats just go along and vote for this continuing resolution? These are the reasons why we can't. Because of the American people, because of our constituents like Amanda and Adam in my district, a real constituent from Grand Rapids. She writes in, my partner, Adam, was diagnosed with a rare form of cancer 3 years ago. As you can imagine, this completely upended our day-to-day lives. It's especially rare for such a young person to receive this diagnosis. We connected with specialists. Due to the rare nature of the disease, Adam ultimately decided to pursue his medical oncology at the Mayo Clinic in Rochester, Minnesota, and his surgical oncology at the National Institutes of Health in Bethesda, Maryland. We were somewhat aware of NIH, but had no idea what an amazing institution it is, covering the cost of care and even the cost of travel, all in the service of research advancement and public health. He's also benefited from NIH funding through the Mayo Clinic via an NIH-backed clinical trial he participated in at the beginning of his journey. He and I have literally lived at the NIH campus while Adam underwent 5 separate surgeries and recoveries in the span of 3 years. The longest surgery of which was approximately 16 hours long and required 2 weeks in a clinical center to recover. Without exaggeration, my husband may not be alive today without his care team at the NIH. He's currently doing well and considered to be NED, no evidence of disease. But the statistics for his cancer are grim, and we are not naive to the possibility of it returning. We are horrified that NIH and our nation's public health have been infiltrated and put at risk by political interest. No one wins in this dystopian situation. We need to protect the world-leading work of NIH and the entire HHS. As NIH is gutted, it leaves us with fewer options should Adam's cancer return in the future. I live by the mantra that I am always willing to compromise, but not compromise my values. We are here because we're willing to come up with a compromise that funds our government, but not willing to compromise on our values of protecting healthcare for the American people. Thank you. I yield back.
Thank you so much, Congresswoman Skolton, Congressman Byer, Congresswoman Moore, classmate. We appreciate your advocacy on behalf of your constituents and the American people. And as you make your way from the table, I will ask Congresswoman Melanie Stansberry of New Mexico, Congresswoman April McLean Delaney of Maryland, and Congressman Steny Hoyer, our former whip and majority leader, to come to the table. And in order of seniority, as he takes his seat, I will recognize the gentleman from Maryland, Mr. Hoyer, for his opening remarks.
Is it on? Okay.
That, in my view, is why we're here. A lot of Marylanders are anxious, worried, and in many cases fearful that they and their families will either lose their health insurance or won't be able to afford the coverage they've had. You've heard many instances of that being the case. 190,000 of them will see their monthly health care premiums skyrocket by an average of 68%. That's in the small state of Maryland. Another 110,000 of them will see an average increase of 17%. Some 181,000 Marylanders are at risk of losing coverage altogether because of Republicans' manufactured healthcare crisis. Extending these tax credits is not an abstract issue for Marylanders. It will determine whether they have to ration their medication or face bankrupting costs. It will determine whether they can keep food on the table and a roof over their heads. Marylanders cannot afford to look away. Sadly, House Republicans are away. For the second week in a row, they are nowhere to be found. They could have worked with Democrats to protect the health of the American people. They could have worked with us to keep the government open. Instead, they are absent without leave. Although I suppose the Speaker would say he gave them leave. They left the American people on the tracks, and the train is now coming. The time to act is now. Premiums are at hand. The loss of coverage is fast approaching. The urgency for action is now. Not November, not December, not a CR to March 15th, as happened last year, but now. The only way to avert the healthcare catastrophe that is about to befall the American people is for Republicans to do what democracy demands: work across the aisle to create consensus. Instead, they turn their backs on consensus. The same person I quoted, Russell Vogt, was quoted just a few weeks ago that there ought to be less bipartisanship in the Congress. Let me repeat that. There ought to be less bipartisanship in the Congress. They heed the direction of Director Vogt to have less bipartisanship, not more. That is the exact opposite of what the American people ask all of us to do. Republicans continue to leave Americans waiting. Americans are still waiting on Republicans to lower cost, something Trump promised to do. Americans are still waiting for Republicans to make America healthy again. Rather, they abandon them on their health care. Americans are still waiting on Republicans to govern. Now, committee, I would like to call your attention to, because there's a lot of talk about who's responsible for this. Ronald Reagan was president when I came to the Congress of the United States. In the 8 years that he was president of the United States, there were some 8 shutdowns. One year he didn't have 7 he had. And I want to tell you how long they lasted. 1982, 1 day. 1983, 3 days. 1983, 3 days. 1984, 1 day. 1986, 1 day. 1987, 1 day. Why were they so brief? We controlled the House. The Democrats controlled the House. Ronald Reagan was president of the United States, and the Republicans controlled the United States Senate. It was because we all believed shutting down government was a stupid, harmful, and expensive policy for all America, not just federal employees, but all those whom they serve every day, answering phones on Social Security, helping veterans get their health care, doing the things that government does for our people. So it's shutting down America that we're really talking about. And the reason they lasted 1 and yes, 3 days, which by the way was over a weekend, was because each of the parties, the Republican president, the Republican Senate, and the Democratic House were willing to talk. We're willing to compromise. We're willing to bring this crisis to a quick close. How we all hope that we will learn that lesson from Ronald Reagan, from the Republican Senate and the Democratic House for those 8 years. Come back, Republicans. America needs you. Thank you so much, Madam Chair.
Thank you, Congressman Hoyer. Next, Congresswoman Melanie Stansberry of New Mexico.
Thank you, Madam Chair. Colleagues, thank you for being in Washington, D.C. to do your jobs. Thank you for flying across the country, leaving your families, coming back to Washington to show up for the American people, American democracy, for common decency and basic human dignity. We're here today to say, reopen the House, reopen the government, fix American healthcare, and do your jobs. Now, this fight is personal for me. Like so many New Mexicans, I grew up in a low-income family with a single mom who was self-employed. We didn't have health insurance until I was an adult. And yesterday was the 2-year anniversary of my mother's death. After she survived 15 years with a brain tumor, discovered before the passage of the Affordable Care Act. A life-saving MRI and credit card debt that not only saved her life, but enabled her to live with dignity. That put her thousands of dollars in debt and saddled my mother for the rest of her life with the prospects of having to decide whether or not to pay for housing, food, healthcare, and basic necessities because we had failed to act as a country until we passed the Affordable Care Act. If we do not fix healthcare, people will die. People will lose their healthcare. Now, this may not matter to Mr. Mike Johnson and the billionaires that they're serving, because it doesn't matter to them if it costs a few $100s extra a month for them to pay for their health care. But let me tell you, for people like my mother, for people like me, for people like New Mexicans across the state and millions of Americans across this country, it will mean the difference between putting a roof on their head and being able to put food on the table. It will mean the difference between ensuring their families and their children and saving their lives and making sure that they have access to health care. And so while I understand that my colleagues across the aisle think that this is some sort of game, that they think they can just shut down the House and stop showing up for work and not come to Washington, D.C., that they can just tell the American people to eat these costs and tell Democrats that they don't have to negotiate. This is literally life or death for millions of Americans. So what we're here today to say to our colleagues across the aisle and to Mike Johnson is do your job. Come back to Washington, D.C. and negotiate in good faith, because this is a matter of life and death for millions of Americans. And this is not a game, sir. This is not a game. This is American lives. And these stories are not hypotheticals. These are real people. In New Mexico last week, our state legislature under Democratic control, our Democratic governor, Michelle Lujan Grisham, who served in this great body, and our Democratic legislature said, we are not going to let New Mexicans starve and go without health care. And so they ponied up, they held a special session, and they put tens of millions of dollars on the table to make sure that New Mexicans are okay for the next several months. But there are 49 other states that have not yet acted. There are millions of Americans that will go without healthcare and without assistance if we do not act. And so that is why we are here. That is why we showed up. That is why we are calling on our Republican colleagues to get back to Washington. That is why we are asking to reopen the House, to see Adelita Grijalva, to pay our federal workers and our troops, to save our healthcare and do your damn jobs. Get back here. This is about basic human decency and the commitment to the oath you took. So, Mr. Speaker, we ask you, come back. And with that, I yield back.
Much. Thank you for sharing that deeply personal story, Congresswoman Stansberry. Last, but certainly not least, one of our newest members, Congresswoman April McLean Delaney from the great state of Maryland.
Can you hear me? No. How about that? Okay, great. I have to say, Congresswoman Stansberry's very emotional plea for our colleagues to come back and to sit on the other side, Steny Hoyer, who leads up the senior House member of my great state of Maryland. But it's about values. And I just have to say thank you to our Democratic caucus for showing up to care, that we care about people and who we are as Americans and what we stand for and what health and well-being for everyone means in this country. And I so appreciate your stories and what that means, because those are echoed across every district and every state in this country. So I represent Maryland's 6th congressional district, and I call it a microcosm in miniature of America. Red, blue, suburban, urban, rural, 5 national parks, 35,000 government employees, loyal employees, civil servants who show up each and every day, irrespective of party, just to serve. And the tsunami of cuts that is hitting our residents, including these public servants who might now see a loss of health care, is staggering. And by way of data, as of 2024, 21,000 people in Maryland 6 received tax credits in the ACA to lower their premiums, and up to 9,000 families are projected to lose their health coverage. A family of 4 making $64,000 a year in Maryland would see their premiums decrease 200%. Those are statistics, but there's also stories. But first, I have to say this week, none of us wanted to be in a government shutdown. And our Democratic colleagues worked hard to avert it. As Steny Hoyer said, it is our fiduciary duty, and we've had limited government shutdowns in past administrations because it's not good for the American people. Having said that, and I was on a teletown hall last night with 15,000 people calling in, many of them about healthcare. Some things are so important, they're worth fighting for, like standing up for our health and well-being for Maryland and all of America, and making sure that we don't sign off on a budget that makes life less affordable and harder. And where our missing Republican colleagues waiting for the president's approval to show up, they're home. They're home. But we're here doing our job. And as my husband John and I often say, you can't fake showing up. And we're showing up. So last week, I was with the Women's Democratic Caucus, and they came out and toured with our local officials in Maryland, in Germantown, the Up County Regional Health Center, a one-stop shop for our neediest residents, from dental and maternal health to Medicaid and SNAP benefits. This is an essential lifeline for many of our most vulnerable. And these type of facilities provide both state and, most importantly, federal assistance, which is stable and reliable. That tour reinforced my view, and many who were there, that healthcare is not a talking point. As I said, it's a lifeline. And when federal funding for Medicaid and critical services is cut, the impact is staggeringly real. Across the 6th, 1 in 7 families depend on Medicaid. And statewide, more than 247,000 Marylanders are enrolled in the ACA marketplace coverage. I think that was put forth by Steny Hoyer. Nearly 9 in 10 of them depend on premium tax credits to keep it affordable. And without those credits, families in my districts will see premiums rise by hundreds or thousands a month. Last week, on the Capitol steps, I met Tony, a father with a young family. He's undergoing chemo for his aggressive cancer. He personally stated to me, after his public comments, that without the ACA tax credits, his premiums would double, and he truly was afraid that he would not be able to continue his treatments, and thus he would not be able to continue to live. These are not statistics. They are true impacts on families. But for Western Maryland, which is rural, Maryland's rural hospitals and clinics really could be forced to close medical wards, maternity wards, cut mental health facilities and addiction programs, or just shut down entirely. And the tsunami of cuts hitting our states on multiple fronts, they can simply not fill the gap. That is unacceptable to me because I don't want our mothers in Garrett County to be left without maternal care. And I definitely don't want our seniors in Allegheny, which they've talked to me a lot about, to be forced to drive 3 to 4 hours to receive critical medical treatments. So I've traveled in the last 2 weeks across Garrett, Allegheny, and Frederick counties, and Washington County as well. And they all say that they are worried in rural America about people falling off of Medicaid and the uninsured rushing their emergency rooms. I repeat, hospitals could close. And for instance, some of these hospitals have 60% of their patients on Medicaid. Last, I'm the only Marylander on the House Agricultural Committee. Farmers are already under economic duress from tariffs and economic uncertainty and loss of SNAP. They're also really stressed about health care. Half of the women in America deliver on Medicaid. But those communities also encompass farmers who are in essence small businesses, and many of these utilize ACA credits. It's estimated nationally that 27% of our farming families, many of them who are older, rely on the ACA tax credits. This was mentioned several times last night at my town hall. And then my final point, I'm going to say, this GOP-driven shutdown is hurting Maryland and states in other ways. Not only federal workers without paychecks and small businesses and farmers caught up in economic uncertainty, weird sombrero memes and grim reaper memes aside, this administration's authoritarian actions have targeted our federal agencies, NIH cancer trials, and the withholding of emergency FEMA funding and the rescission of federal grants for infrastructure and energy projects. These actions, too, hurt the health of our state and of our working families and our dedicated civil servants. And they also undermined our national security and, most importantly, trust in our government. So let me be clear. We cannot let the health and well-being of our citizens, of our state, or of our country to be held hostage to partisanship, retribution, and these cruel-hearted cuts. And I will work in a bipartisan way to end this shutdown. But I have to stay united with my Democratic colleagues, as well as my state, in the fight to extend ACA credits, to protect Medicaid, and to lower the cost for all Americans. Wes Moore, our governor, often says, we leave no one behind in Maryland, and we in our Democratic caucus cannot afford to leave any Americans behind either. Thank you.
Thank you, Congresswoman McLean-Delaney, Stansberry, and Hoyer. And as you make your way from the table, we'll ask Congresswoman Joyce Beatty of Ohio, Congressman Stephen Horsford of Nevada, and Speaker Emerita Nancy Pelosi from California. A powerhouse panel.
That's right.
Minus Horsford. I think it goes without saying that I would recognize Speaker Emerita Nancy Pelosi for her opening remarks.
Thank you very much, Madam Chair, and thank you to the Steering and Policy Committee for the excellent work that you do, policy and steering in our caucus and in the Congress. It's an honor to be here with Joyce Beatty and Steve Horsford and with all of you. I see Congresswoman DeLauro, a former chair of the Steering Policy Committee for many years, also of the Appropriations Committee, having such a hand in this legislation that we're fighting in terms of getting health care permanent for our people. Let me just, I saw that members put their remarks. I have my remarks. We had a press conference the other day in San Francisco with with Jared Hoffman and with Kevin Mullen, two members who butt the district that I have the privilege of serving in San Francisco. And we had people come tell their stories, and one of them gave me permission to further bring the story here today. But before I do, just to say a couple of things, because I see that others have placed their story in perspective. Here we are at a place that I think is very critical for our country. Those in the White House and on the other side of the aisle have done nothing in their time but except to undermine the Affordable Care Act. Not only that, in the 90s, put Medicaid in a box, tie it in a ribbon, they're ready to throw it in the deep blue sea. They said, and some of you remember, Betty, you do remember when they said, Medicare should wither on the vine. Again, scores of times that others of you participated in when they tried to eliminate the Affordable Care Act, repeal the Affordable Care Act. So they do not believe in any of this. They do not believe in governance. They never voted for any of the things I just mentioned. So we have to be very cautious because this is not about incrementalism. This is about elimination because they don't believe in governance. That's why they even say they're not going to pay our employees who are not working now, but because they don't believe in what they do. It's a shame, a pity, and it flies in the face of all that we have done for the people, for the children, for our country. We have an obligation as we sit before the flag, the vision of our founders about this great country and what it's about, and about what our obligation are to our troops who vote to make this country so great, and also our children for whom we're here to protect. So understand this, when they make this, like a reporter said to me on TV this morning, well, they just want to make some improvements, reforms. I said, what reforms? 20 times at least, maybe 60, 70 times, they tried to repeal it. They weren't suggesting any reforms then. What reforms are we talking about? Well, they might have an idea. They might have an idea. Their idea is to give a $4 trillion tax break the wealthiest people in our country, tax to wealthy people and corporations at the expense of our children. And I declared there on that show this morning that Donald Trump is the worst president of the United States for children. And many of us are here for the children, but he's taking food out of their mouth to give tax breaks to the rich, removing their health care, talking in ridiculous terms about climate and clean air, clean water for our children. Forget about it. Gun safety, forget about it. Everything you can name, he has been a problem for the children. But we come to this point where we're talking about health care, which is a health issue. It's also a financial health issue. People can't afford all of this, especially now that they want to take away now, as you know, we passed the Affordable Care Act. We were not one Republican vote, but we did it because we had public sentiment with us to help us win the vote. The diagnosis groups, any diagnosis you could name was there helping us. We saved it because we had 10,000 events around the country for people to tell their story. And that's why this is so important today, to tell the story. Nothing more important. It's better than any provision of the bill you can name or any politics you can talk about or any motivation somebody may have, because it's the story of people and what the Affordable Care Act meant to them. But it's not just about the Affordable Care. It's about the Affordable Care Act. It's about Medicaid, which contained in that, Medicare, which is contained in that. $600 billion from Medicare. Hundreds of billions of dollars from Medicaid. One that gets me the worst that I don't think they could possibly, maybe they don't understand that, but they do understand food for children, hundreds of billions of dollars from SNAP, hundreds of billions of dollars. From SNAP. So their goal is to reduce any government participation in improving the lives of the American people. That's who they are. That's who they are. And they say it proudly. And then they say, oh, they should go to work. As soon as they go to work, they lose their ability to qualify for Medicaid. That's part of their thing. And they have their friends that they give tax breaks to who are hiring these people at low wages and sending them right to sign up for Medicaid. Sign right up for Medicaid. Again, adding to the cost to the taxpayer and subsidizing their low wages. So there's all kinds of sociological, economic things involved here that they are intricately involved in trying to hurt the American people. We had a story at our press event, like we had many stories, but the one that I bring here. Cinnamon is a San Francisco native and a stay-at-home mom of 2 young boys. Last November, her husband was laid off, and she immediately applied for Medi-Cal. That's Medi-Cal is Medicaid in California. Just weeks later, her 4-year-old son became dangerously ill. After multiple ER visits, he was admitted to the hospital for a life-threatening infection. He spent 3 weeks in the hospital, came home on 9 different medications, and is still under the care of 4 specialists. Doctors haven't ruled out an autoimmune condition. Thanks to Medi-Cal, Cinnamon's family paid nothing. Without coverage, the hospital bill alone, over $300,000, would have bankrupted them. After 9 long months of job searching, her husband finally landed a position at a well-known tech company. Cinnamon breathed a sigh of relief, thinking her family was finally secure. But as a contingent worker, her husband doesn't get the same health benefits as regular employees. The family plan costs $200 a month, completely out of reach, and with this new income, they no longer qualify for Medicaid. They no longer qualify for Medi-Cal, California. This is the thing. Go to work, send her to work, but and then they don't qualify for Medicaid. They know that. This is why the Affordable Care Act healthcare tax credit matters so deeply. Without those tax credits, Cinnamon's family and thousands like her could lose coverage altogether. They've done everything right. They've worked hard, applied for coverage, made responsible choices, and yet without these subsidies, they could still fall through the cracks. No parent should ever have to wonder if their child's life depends on whether they can afford an insurance premium. Extending the tax credits means families like Cinnamon's can stay protected, continue to recover, and live without fear of financial ruin. Open enrollment for Marketplace begins in November. Plans need time to update premiums for next year, which is why Congress cannot afford to wait and must act now. And that's why we have to have a permanent solution to this. Families like Cinnamon's are counting on it. And we heard story after story when we heard the 10,000, we had the 10,000 meetings where people told their stories. My father had a stroke. My baby was born with a heart condition. My wife is suffering from breast cancer. The list goes on and on, very familiar to the American people. That is what is going to open up government, the stories of the American people. So thank you for raising the profile of all of this so that people will tell their stories as well as have us tell them here. Thank you, Madam Chair. Thank you, members of the committee.
Thank you, Madam Speaker. Next, former Chairwoman of the Congressional Black Caucus, Congresswoman Joyce Beatty.
Thank you, Madam Chair, and to the members of the Steering and Policy Committee. And let me also thank Leader Jeffries for convening us and having Democrats here doing our job.
That's right. Let's applaud that. Great.
I am here and am thankful for the opportunity to testify today on behalf of the families, seniors, and working people facing a healthcare crisis in this nation, and particularly in my 3rd congressional district, which I represent. I am a subcommittee ranking member on financial services and chair emerita of the Congressional Black Caucus. I'm here today because I have seen firsthand the impact of how economic and health insecurity go hand in hand. And I know the lapse of federal health care subsidies will leave millions of Americans at risk, including low-income families, seniors, and people of color who already face barriers to care. I want to share a story of Clara, a constituent who has multiple family members that rely on the Extended Affordable Care Act healthcare tax credits to afford the medications that they take to survive their chronic health condition. If the premiums skyrocket, they will not have the support they need for those medications and their periodic medical appointments to monitor their conditions. Medicaid isn't a handout to be thrown away with budget cuts. It's a lifeline for people fighting to stay healthy and for the safety net providers like Heart of Ohio Family Center, who serves them in my district, which is a not-for-profit FQHC, a federally qualified health center, which serves individuals and communities that might otherwise lack access to healthcare services. Another perspective from my district comes from a medical expert, a physician and a state senator, Dr. Beth Liston, who speaks out loudly about lives being at risk. And she also speaks out loudly against the Trump administration. She has gone on record saying, in Ohio, people are struggling. Close to 40% of children are covered by Medicaid and CHIP. Half of all babies delivered in Ohio are delivered through the Medicaid program. Our Medicaid expansion population are our highest users of mental health and addiction services at a time where we're battling suicides and overdoses. And let me finally conclude, like so many of the other members who have testified here today, and thank the Democrats for being here, for doing our job, for fighting for health care. And this is personal to me. As a former Dayton, Ohio Stillwater Hospital administrator, I watched children get the care that they needed, and they were able to do that because of affordable health care. Watching my mother in her last days before dying with cancer, watching the care that she received, and now thinking back today, what would have happened if we weren't fighting here to lower the costs, to save the cuts, and to save health care. And I think it's so important for us to know that we are in a shutdown, and we need to say it repeatedly because Republicans are in charge at the White House, in the Senate, and in the Congress. And it is their responsibility to fight for the American citizens, to fight for health care, and they are not doing their jobs. And because they will not join us to save the cuts, lower the costs, and fight for health care, we are in a shutdown. And it is so important that the American people know that they are lying to them. And where are they? They are not here, but Democrats are here fighting for the American people. So health care should not depend on your zip code, your race, or your income. And in my great state of Ohio, 460,000 individuals will lose health care due to the big ugly bill, and 32,000 of them live right there in my neighborhood, in my district. Democrats are fighting for you. We're fighting to save health care. No health care, no vote. Thank you, and I yield back.
Thank you so much, Congresswoman Beatty. Another former chair of the Congressional Black Caucus, Congressman Stephen Horsford from Nevada.
Thank you to Chairwoman Wasserman Schultz and to Chair Barragan and Chair Kelly, and to the entire Steering and Policy Committee, as well as to Leader Jeffries for hosting this important hearing on the Republican-fueled healthcare crisis. It is not lost on me that I am sitting on the dais with history makers who helped to shepherd through the Affordable Care Act. And I would be remiss if I did not thank Speaker Emerita Pelosi for your leadership as the Speaker who passed the Affordable Care Act into law. And to my dear friend and former chair of the Black Caucus, Congresswoman Beatty, and all of the members who are speaking very clearly with purpose about why we are here. This budget impasse is about healthcare, which is, to me, a fundamental right, but it's also an economic imperative. And outside of housing, it is the single highest cost that a family has to cover, whether that's in copays or premiums, prescription drugs. And that's the point. But we're here, and our Republican colleagues are not. The sad truth is, we have a White House and a Republican conference, both here in the House and in the Senate, that haven't listened, that aren't aware, or honestly do not care about the American people's right to affordable, accessible health care. And I do want to thank Leader Jeffries and House Democrats for being here, for calling us back to do our job. I don't know where else we would be, but here during the 8th day of a Republican-caused shutdown in order to protect a fundamental right to health care. So I want to thank my members, all of us, for showing up, for standing up, for speaking up, and for fighting back, quite frankly, in this moment. We are here and we are ready to work, ready to negotiate, ready to deliver real relief to the American people. And the timing really couldn't be more critical. They keep saying we have time to deal with these enhanced premium tax credits. We're past time. November 1st marks the start of open enrollment for the next year, and letters of notification of premium increases are going out as we speak. In Nevada, families will sit down, log into their Nevada HealthLink account, and figure out how to protect their health and their budgets for the year ahead. Make no mistake, congressional Republicans know this. Speaker Johnson is betting that by giving his conference an extended vacation on the taxpayer's dime, I might add, that he can block a deal and let chaos do the work for him. Well, Republicans could have acted. They had a choice. They had a choice when we were debating these issues in the Ways and Means Committee. Their big, ugly betrayal of a bill that's now law not only provided permanent tax cuts to billionaires, permanent tax cuts to them that were not paid for, that adds $3.5 trillion to our federal debt. And now they say they don't have the time or the money to give tax relief to middle-class families to cover health care. To me, that is disrespect. You had the time to give it to your wealthy donors, but not to middle-class families. Well, when the House Ways and Means Committee majority came to Las Vegas to sell their scam of a bill, they barely let the public in the room. And that's why I'm thankful again to the staff and others who also are helping to make sure we're bringing this message to the people. If they had done that, they would have heard the truth from Nevadans in my district, including Raquel from North Las Vegas, who works at a local hospital and who shared with me that the Affordable Care Act has been a lifeline for her patients across Nevada. But she also warned that the big ugly law is threatening that progress, forcing her employer to cut her and her coworkers' hours by 20%. And Raquel said it best: if the Affordable Care Act is eliminated, we will all fail. Eva, also from North Las Vegas, shared the impossible challenge of caring for her aging parents while managing her own chronic illness. Her family simply can't afford higher insurance or prescription costs. Her words stuck with me. Call me crazy, but being able to do the little things because of access to health care makes life so much easier. Well, here we are. Republicans are causing a direct assault on healthcare, and they're making life harder and more expensive, while Democrats are fighting to expand access to healthcare and to make life more affordable. That's worth fighting for. And Richard shared a heartfelt plea to make the healthcare tax credits permanent. Without them, his premiums would soar 150%, up $1,800 a month. Think about that. $1,800 every single month. And now there's this narrative that they're trying to set that this is some type of hand-me-out. After they just gave the tax cuts to the billionaires, they can't provide tax relief, leveraging our tax code to support middle-class families to keep their health care. This is personal. Each of us has stories of constituents and our own lived experiences. I'm struggling with a family member right now who is managing through Medicare, Medicaid, and Social Security. This is real, and it's life and death. So I appreciate all of my colleagues and their impassioned work and pleas, and I urge Speaker Johnson, call the Congress back into session, open the doors of the House, let the members of Congress do our jobs, swear in Adelita Grijalva as the next member of the House of Representatives, and let us cancel the cuts, lower the cost, and protect health care for the American people. With that, I yield back.
Thank you so much. Well said. Thank you to all three of our esteemed panelists. And as you make your way from the table, I will ask Congresswoman Nikki Budzinski from Illinois, Congresswoman Betty McCollum from Minnesota, and Congresswoman Rosa DeLauro, my chairwoman of the Appropriations Committee from the great state of Connecticut, to have a seat at the table. As Congresswoman DeLauro takes her seat, she will be up first.
Thank you very much. What an honor it is for me to be here today. And I want to say a thank you to Steering and Policy for organizing this effort. What an opportunity for all of us to be able to talk about the issue that's mostly on people's mind today, and that's healthcare costs, but also to tell the stories of the people that we represent and to bring that narrative here and to get it out to the public. I represent Connecticut's 3rd Congressional District, and I'm here because of the cost of living has hit Connecticut hard, very hard. President Trump is making it worse. Cost of living is the biggest issue facing the people in the United States. People today live paycheck to paycheck in this nation. They're dealing with the high costs of groceries, housing, electricity, but healthcare, the cost of healthcare is one of the biggest household expenses that most Americans face. Medicaid, the Affordable Care Act are pillars that hold up our health insurance system for Americans who do not have insurance through their jobs. Without these programs, people are left vulnerable. Yes, they're left on their own. President Trump is trying to demolish those pillars. He has refused to extend the insurance premium subsidies for families. What do those subsidies do? They help them to purchase health insurance on the state exchanges. And that is the issue around this shutdown. Is that President Trump refuses to come to the table to negotiate about the healthcare crisis that he is responsible for. in the cuts to Medicaid and to the premium subsidies. He will not negotiate. Democrats ready, willing, and able to negotiate. That is why he has shut down the government. On Monday, I held a roundtable with primary care physicians in my district. One doctor told me that as soon as next month, November, people will begin to stretch their prescriptions, skip refills, delay essential care. Another told me that over 40% of our children in our state are on Medicaid, and losing coverage for only half of those children would be devastating for us long term. Thanks to President Trump, premiums in Connecticut could rise dramatically by an average of 17%. Family of four with a household income of $130,000 could end up paying nearly $13,000 more for premiums. A family of three making $109,000 could see an $11,000 increase. And an older couple with an income of $85,000 could see their premiums increase by nearly $30,000 a year. These increases are completely unaffordable for families who are already living paycheck to paycheck. It is about the cost of living. How do people afford price hikes like this? I also held an event where I heard from individuals and family members of those living and working with disabilities under various Medicaid programs. Their stories were poignant and inspiring. Stories like Brianna and her son Maverick, who was born premature at 33 weeks and just under 3 pounds. They spent 30 days in the NICU. Then they were enrolled in Birth to Three, a state Medicaid funded program which provides wraparound support and information to parents of children with disabilities. The medical experts in Birth to Three program gave Brianna tips on how to strengthen Maverick's neck and spine so that he could learn to crawl and he could learn to walk. They told her of how to navigate appointments with medical teams and help support him all the way through preschool. Karen, who uses MedConnect, a program that provides health insurance for employees with disabilities. Karen has learning disabilities, was institutionalized for 24 years. She worked hard to develop the skills to live independently, and she now lives alone, working 20 hours a week at a grocery store, learning a variety of positions. She earns too much to qualify for Medicaid, but MedConnect allows her to earn Medicaid benefits while working, covering her dental care and other essential health needs, making her independent. It is Chris, an adult living with a disability who was able to receive employment supports from Medicaid to spend time with an aide at the local library until he found a dishwashing job that could support him and allow him to live on his own, once again, becoming independent. These are the few of the powerful stories that I heard. I know that there are more like this in every state. If Connecticut is forced to make cuts to state programs due to the $1 trillion being cut from Medicaid and the big, beautiful bill, programs like Birth to Three and others would be severely reduced or eliminated. And that is why Democrats are fighting so hard to extend the insurance premium subsidies. And we need to do it now, not in December, as Speaker Johnson has talked about. Why? Because in my state, the notices are going out October 20th of premiums and increases. November 1st is open enrollment, and the first payment that people need to make is on December 15th so that they can be covered by January 1st of next year. We are here. Where are our Republican colleagues? Don't make light of it, but where's Waldo? Where in the hell are they? They are on vacation. You know, police and fire are on the job. Capitol Police are on the job. You can talk to them, and we should say thank you to them for being here because they're not getting paid. They are being furloughed, or they're going to be paid after the fact. Thanks to Democrats for addressing this issue and bringing it before the American people, because without the Democratic advocacy, the public would not understand the depth and the breadth of this healthcare crisis that is before them. Democrats are at the table. We are ready to negotiate, and the message is clear. Lower the costs, cancel the cuts, and save healthcare for the American people. Thank you for this opportunity, and thank you for doing this.
Thank you so much, Congresswoman DeLauro. Next up is my fellow appropriator, Congresswoman Betty McCollum from Minnesota.
Thank you, Madam Chair. I appreciate the opportunity to testify on the attacks of healthcare that my constituents are hearing about at the hands of the Trump administration and the Republicans of Congress. Let me be clear why we are here today. This is a Republican shutdown of the federal government. Democrats are here in Washington. We're ready to work. And yes, we are ready to negotiate. But the House Republicans, they're nowhere to be found. And that's because Speaker Johnson decided to cancel votes in the House. Now, why did he do that? Because Republicans have created a healthcare crisis and they don't feel the need to work with Democrats to fix it? All of this is happening, as has been pointed out by numerous speakers. Americans are experiencing sticker shock of the high, skyrocketing healthcare premiums that are coming via mail. I'd like to give a few examples of what Republican leadership has done to healthcare in this country. Their big, ugly law nearly cut $1 trillion from Medicaid. Let me say that again, $1 trillion cut to Medicaid. 15 million Americans are at risk of losing their coverage because of this law. In my state of Minnesota, that could be up to 140,000 people who will lose healthcare coverage. And yet the Republicans refuse to do anything about it. Republicans in Congress and the Trump administration have made so many cuts so quickly on so many fronts that it's difficult to keep track of the damage that they're doing. To understand the impacts of some of these changes, I have spent this year holding and attending town hall meetings to hear directly from my constituents on how they're being affected. My latest town hall included a wide range of expertise from providers, patients, and other professionals working in the healthcare sector. These experts came from all backgrounds, and they shared the same concerns, identical concerns, how Americans will lose access to healthcare and how it will affect their future. The stress, the confusion, and the defeat being felt by Justin is just one example, and it's unacceptable. Let me tell you what Jason shared with me at our hearing. And these are his words. And I think he's speaking on behalf of 1.2 million of his fellow Minnesotans that rely on Medicaid to live their lives. Justin's a 27-year-old writer, blogger, and disability rights advocate living with cerebral palsy. And during our discussion through an adaptive technology, he shared the following with me, and I quote, "My life as I'm currently living, that I've worked so hard pulling together over the last 9 years, it feels like it could implode," end of quote. Medicaid alone is what pays for Justin's medical care, medical equipment, staffing, and more. This aid means that Justin can have things like a communicative device so he could speak at our meeting, a wheelchair that allows him to move comfortably throughout this world, an adaptive shower and toilet so he can live his life in dignity. And everything I just mentioned would cost Justin and his family up to $49,000 a month. Right now, these expenses are covered through Medicaid. And right now, they're all at risk. So what happens to Americans like Justice when this funding is just snatched away from them? They feel stress. They feel confusion. But it's not just Medicaid now that they have to worry about. The Republicans' shutdown has highlighted the cancellation of the affordable tax care credits. 22 million Americans rely on the ACA tax credits to make their health care more affordable. So in Minnesota, that's 90,000 people who use these credits. And without them, they can start to expect to pay, on average, $180 more each month or $2,160 per year. And many will even pay more than that average. Minnesota families are telling me they just cannot afford this kind of increase. And that's why the ACA tax credits were canceled in order to make billionaires and corporations have a sweetheart deal on their taxes. Oh, and theirs were made permanent. So Democrats asked Republicans to join us in extending these tax credits in the legislation that we proposed. Thank you. My ranking member has a great piece of legislation to take care of and fix this. But instead, they're not showing up for work. They refuse to work with Democrats, and they are failing to keep the government open. The future of healthcare in our country is at risk. It's our national security, and it's our economic security and our personal security that's at risk. And that's why we as Democrats are standing here and asking our Republicans to join us to change the direction of what is happening to healthcare in this country. So I, along with my colleagues, we're ready to work. We're ready to negotiate. We just need Republicans to come to their senses and negotiate with us in good faith. Madam Chair, I yield back.
McCollum. Now, Congresswoman Nikki Baczynski, a second-term member from the great state of Illinois.
Thank you very much, Chairwoman Wasserman Schultz. And I want to thank Leader Jeffries and the Steering and Policy Committee for hosting this and to giving me an opportunity to lift up some of the voices of constituents that are deeply concerned about this Republican healthcare crisis that has been created. I want to highlight in particular two constituent stories from my district, specifically in Alton, Illinois, who will be impacted if the Affordable Care Act enhanced premium tax credits are allowed to expire on January 1st. Laura and Rick are a married couple in their early 40s doing their best to make ends meet. Laura is self-employed and cleans homes across the community. Her clients have come to develop a trust with her over time, so she also helps with caregiving responsibilities. Rick is a carpenter who works long hours across the river in St. Louis, Missouri. Together, they have 3 kids, 2 grown in their 20s, and their youngest, an 18-year-old in high school, getting ready to start in community college. Over the past 4 years, Laura and Rick have relied on and enjoyed the ACA marketplace coverage. They currently pay a premium of about $300 per month, which allows them to access important medical screenings and lab work specific to the care that they need. Without the ACA enhanced premium tax credits, their premiums will jump up more than $810 per month, an increase of more than $500 every month for them. Coverage for the year would cost nearly $10,000. Laura told my office, and I quote, "We're already starting to have painful conversations about what we'll have to cut from our family budget. We may have to stop saving for retirement or pull from what little we've saved. We may have to give up the small family vacations that they're able to afford." A middle-class family like Rick and Laura shouldn't be terrified of what a single medical emergency would do to them or one of their loved ones. In Laura's words, it would bankrupt us. Those are her words. Laura and Rick currently help pay for dual credit college courses for their 18-year-old daughter, who is a senior at Alton Community High School. However, they are very concerned they will not be able to help put their daughter through college if they are forced off of their health insurance. Losing their tax credits not only threaten their health care, it would also put at risk their entire financial stability, their retirement, and their daughter's college aspirations. We cannot allow families like Laura's to lose their health care and force them to choose between their retirement and their daughter's education. We absolutely must extend the ACA tax credits in order to help families, everyday Americans like Laura's. And I would just say this is one story of many. I know in my district, we estimate about 17,000 families take advantage of these ACA tax credits. And so I hope that Republicans will get back to work, come to Washington, meet with us, negotiate on a bipartisan basis to provide this relief. This healthcare crisis is manufactured and of their own doing. And that's what we're simply asking, to support the families like the ones that I'm so proud to represent in Central and Southern Illinois. So thank you so much, Chairwoman. I appreciate the opportunity.
Thank you so much, Congresswoman Bazinski, McCullum, and DeLauro. We appreciate your advocacy, and as they make themselves make their way from the table, I ask Congressman Jimmy Gomez from California, Congressman Gabe Amo from Rhode Island, and Congressman Herb Conaway from New Jersey to please join us at the witness table. Oh, I'm good. Thank you. Thank you, gentlemen, very much. We'll begin with the most senior member at the table, Congressman Jimmy Gomez. That's you. First time for everything.
So first, I just want to thank Leader Jeffries as well as the Steering Policy Committee for hosting this. This is an important thing to do, is continuously tell the story and the narrative of what's going on here in Congress. Republicans are AWOL, right? They have basically left their post, are not doing the job that they were sent here to do, which is to fight for their own constituents and for the American people. Even regardless if you disagree with us on issues, you should not be MIA. You should not be gone. And that's what they did. They're gone. And somebody asked me a question, is like, why do you think that's the case? A reporter asked me, why do you think Mike Johnson? I said, in most other shutdowns, what did we see is that they would keep us here working, even if it's on other issues, they would be working to put pressure on the members, to put pressure on leadership, to put pressure on themselves to find a deal. So when Mike Johnson lets the Republicans go home, councils votes, maybe they're on vacation, maybe they're in the district, who knows where they're at? It's because he doesn't want to have that pressure here to reach an agreement that would be negotiated by all the parties involved. So he thinks that he can just by leverage and punishing federal workers, the American public, letting the ACA enhanced premiums expire, that he's going to get his way. That's what that's about is because he wants to once again rip away healthcare from the American people in order to give billions, if not trillions of dollars in tax breaks to the ultra wealthy and the largest corporations in this country. That's what it's about. We hear on the streets, we hear in the lobbying corps that they're talking about another budget reconciliation bill. Why is that? To do more of the same, to do what they did on the one big beautiful bill that cut $1 trillion from Medicaid, that cut SNAP, all to give those permanent tax breaks to those individuals, the largest corporations and wealthiest individuals. That's what they want to do. And we know that the expiration of the ACA subsidies hurts everybody. And one of the things that I know is what it's like when you don't have health insurance. I grew up without health insurance. Most of my life, I didn't have health insurance until I was 25 years old. Think about that. So, and I know what parents do. When you get sick, if you have a child that gets sick or injured, you wait to see if they get better. And if they get better, well, lucky you, you didn't have to spend money, nothing's wrong with your child, and you live to fight another day, for lack of a better phrase. They live to fight another day. But that's not always the case. When I was about 7 years old, I got sick with pneumonia. This was in the middle of summer. My parents were waiting to see if I was getting better. They used home remedies, everything from Mexico that they can think of. I'm glad they didn't kill a chicken and rub it over my head or anything like that. But I got sick, went to the hospital, and because I had a 7-day stay in the hospital, my parents had to put up, this is what they did back in the day, put up the house as collateral. That's what they would do. Put up the house as collateral, and then you would have to make payments. You miss a payment, they take your house. So at the end of that year, I knew that we're in bad shape when my siblings blamed me for not getting Christmas presents that year. But we almost went bankrupt, but my parents managed to make it. And that was because they missed shifts from work to take care of me during that 1 week stay and those hospital bills. Families shouldn't have to make those kind of decisions. They shouldn't have to wait to see if a child or a family member gets better or worse before they get care. And then what happens when they don't have health care, they go to the emergency room. And that costs everybody more because they're required to be seen. So that's what's at stake. It's life or death for a lot of folks. People who are going to get treated or not treated. It means that 4 million Americans will just give up their health insurance. 20 million will have skyrocketing premium costs to an extent that it actually disproportionately going to impact Republican states that didn't expand Medicaid. Those 10 states that didn't expand Medicaid, a lot of their people went onto the exchanges. So they're going to have disproportionately impacts when those premiums skyrocket because these ACA subsidies expire. To an extent that Marjorie Taylor Greene even called this out and called out her own party. If Marjorie Taylor Greene is the voice of reason of the Republican Party, they are in trouble. They are in trouble. So that's what's at stake. It is life or death for people. It's about affordability. And the Republicans need to come back and do their jobs. And no matter what they say, no matter what they do, there's never been a time in history, except under Donald Trump, that a unified government under this president, it's Republican House, Republican Senate, a White House, that the government closes. It's usually in a divided government. As Steny pointed out, in the 80s, it was because the Democrats were in the House and the Senate was controlled by the Republicans. But they managed a deal in a matter of days. A matter of days, they cut a deal. So that shows you what this is about. This is about people fighting back. This is about the Republicans just want to continue their attack on working folks. And we have a constituent who sent me a few constituents. One constituent sent me a letter saying her premiums were going to go up 70%. Another one that used to pay $82 in premiums on the exchanges in California now is going to see an increase of $382 per month. So that's what we're dealing with. People can't afford that. You can't afford those kind of increases. And then with the tariffs that are impacting so many different families, the economy that's really not doing well, people are going to just give up their health care in order to survive, to pay their rent, buy food, to take care of the other basic necessities. And like my family and like myself, you will risk to see if you get better or you get worse. With that, I yield back.
Congressman Gomez, and by just about a year, Congressman Gabe Amo is the next most senior from the great state of Rhode Island. Thank you.
Thank you, Madam Chair, and thank you to the Steering and Policy Committee and Leader Jeffries for ensuring that we reflect the voices of the people that we serve around this country, that we elevate their stories, that we highlight this Republican healthcare crisis and a Republican shutdown. You know, since congressional Republicans skipped town 19 days ago rather than release the Epstein files and help 22 million Americans, including 40,000 Rhode Islanders, afford their health insurance, I've talked with countless constituents at home about how Trump and congressional Republicans made a choice. They made a clear choice. They wanted shutdown and chaos over healthcare for their families. That is a very stark difference in priorities. And so as I moved around the district over the last several days, I met with lots of people. I met with cancer researchers and clinicians at the Lagaretta Cancer Center at Brown University who were affected by Trump's cuts to cancer research. Now, because of the Republican shutdown, cancer patients can't enroll in clinical trials. And I met with the men and women who answer calls from some of the most vulnerable Rhode Islanders seeking assistance with their basic needs at the United Ways of Rhode Island's 211 call center. Because of all we've heard with regard to both the pending healthcare challenges and the shutdown, they saw a 30% increase in calls on the first day of the shutdown. I met with Coast Guard members in Newport who are working hard to keep the waters around Rhode Island safe, the ocean state. But they aren't being paid because of the Republican decision to choose chaos and shutdown over reopening the government and healthcare. I met with families and advocates at the Northern Rhode Island Out of the Darkness Walk to Prevent Suicide, who are terrified that Rhode Islanders won't have access to the mental health care that they need if Trump and Republicans don't come to the table and extend these life-saving tax credits that help so many people in our communities access mental and behavioral health care. I met with leaders in the blind and low vision community at the 55th Annual National Federation of the Blind Convention to hear how critical Medicaid is to ensuring accessibility and the healthcare of this population. And just today, this morning, before I hopped on the plane to come here, I spoke with leaders and state officials at Children's Friend in Central Falls, Rhode Island, to highlight the importance of the special supplemental nutrition program for women, infants, and children that is being threatened by the Republican shutdown. And I know we might have seen something in the news to suggest that the president actually has some concern for women, infants, and children, but we can't take them at their word. We can never do so. And that's why I announced legislation to ensure the states get reimbursed for any shortfall in federal WIC funding caused by a government shutdown. And so I hope that we are able to, amidst this crisis that Republicans are causing, support our families. But, you know, at the end of the day, this is about the values that we have about ensuring that everybody has access to affordable health care, and the Republican values of literally stealing billions from the American people to enrich corporations and the wealthiest Americans. And I think about one of my constituents who is enrolled in the Health Source Rhode Island marketplace, our state exchange, that is keeping her alive. You know, the enhanced premium tax credits for Carla, who is of East Providence, Rhode Island, a great town. It's so important to her that she is able to get her health care through there because she's got a family history of hypertension, a family history of heart disease, and she's spent her career as a mental health counselor. So at age 60, she is in a position where, you know, before she's on Medicare, is seeking out her health care through the exchange, and she is going to see her monthly premiums increase from $427 to $904, a 112% increase. And she's going to try her hardest to keep her coverage because she needs it to stay alive. But she's thinking about food. She's thinking about housing. She's thinking about medication. And at the end of the day, something's got to give. She has limited options and she just wants to stay alive. And so that's the stakes. People will die. They will make choices that prohibit them from living their life to the fullest extent. And in fact, they will make choices that may harm their health, picking housing over prescription drugs one month, maybe switching to paying for health insurance. All of these interlocking challenges hurt us, hurt the healthcare system for everybody. And so just last week, the night before the shutdown took effect, I had a teletown hall with 17,000 Rhode Islanders who hopped on the phone. And to a person, every caller and participant spoke to their fears, but they also spoke to what they want their lawmakers to do and what they've seen out of Democrats and what maybe we can inspire Republicans to do, which is show up. They've seen Democrats show up. They want Democrats to keep fighting. And that's what we're going to do. And we're going to fight to stop the cuts. We're going to fight to lower the costs. We're going to fight to save healthcare. Republicans have to come back from vacation and get to the negotiating table, because the people in their communities are struggling too. The people in their communities will suffer too. And ultimately, their inaction will destroy our healthcare system. It will jack up costs. It will make people poorer and sicker. Those are the stakes. And so I'm grateful to serve the people of the 1st Congressional District of Rhode Island, grateful to be alongside the great Democrats in this caucus who are fighting for their constituents, but we need Republicans to show up and do their jobs. And with that, I yield.
Much. And last but certainly not least, and we won't haze you as a freshman, Congressman Dr. Lawyer Herb Conaway from New Jersey.
Well, I have to tell you, Madam Chair, it is, when I left the Assembly in New Jersey, I was the second most senior person in that body, and now I'm really at the bottom of the heap here. But my name is, and thanks obviously to Leader Jeffries and the steering committee and your leadership and the leadership of Ms. Representative Kelly and Aragon for holding this very important forum, so that we might bring increased attention to this crisis in healthcare that the Republican Congress and the president is bringing to the American people. This is a manufactured crisis. I am, as you mentioned, a first-term congressperson. I'm also a practicing physician, and I've been at this working at policy for the last more than 25 years. It was my privilege as the chair of the National Conference of State Legislatures Health Committee to win the endorsement of the ACA as the ACA was coming into passage, and later was able to pass the New Jersey exchange that has allowed so many people to attain insurance for the first time. I understand all too well how important insurance is to health status. As people gain health insurance, the health status improves. This has been shown over and over again. And unfortunately, we have a party that, as we've heard here today, would rather see these programs wither on the vine. And they have, and it's interesting, and just highlighting as a corollary to what my colleague Gomez has said, it is interesting that while they control the entirety of the government, we've got this shutdown when that ordinarily happens in divided government, when you think there's going to be, when you know there's going to have to be negotiations across party. But here they control the entire thing, the entire government, and here they are not at work, while the American people are suffering under the uncertainty and the fear of what will happen as their health care is cut. The largest cut to health insurance and health access in the nation's history. Untold crisis, unnecessary crisis, and they spent the last 9 months of this administration doing nothing but raising the cost for working families across this country. Whether you talk about the tariffs that are nothing but a sales tax on everything Americans buy, and the mismanagement of the economy, where now people across the world who are in the know, who have money, they're buying what? They're buying gold. When they used to put their money in the dollar, because that was a secure place to put your money. They're mismanaging the economy so much that now people are buying gold, and gold is through the roof. I just want to highlight a story and highlight a few things that are I think are very impactful and that the American people need to understand. I happened to have a Medicaid roundtable in my district a couple of months ago in the wake of the continuing resolution that came up in the spring. And I heard from constituents, regular folks who are on Medicaid. I heard from hospital administrators. I heard from people who are running nursing homes. And there was a story of a mother who came to speak about her child, who was born differently abled, but overcoming her challenges because of the ability of her family to access Medicaid for that child. Mom was able to go to work and continue providing for the family and keeping a roof over their head, and that child was able to progress through school, get into higher education, be able to have the medical support she needed to get through school, stay in school, and go on to higher education, having the support to take up a part-time job while she was in school in a library, working there, and able to live independently in her home because of the support from the Medicaid program, which under these Republican cuts might very well be pulled away from them and upending certainly the life of this young woman and a family who supports that child in her progress through life, totally upending their life. I heard from hospital administrators who were concerned about their ability to keep programs in place at that hospital because of the cuts to Medicaid. Hospitals get revenue from those who have private insurance, commercial insurance, people who are working or their employers are providing for their insurance. They get revenue from the Medicare program, now being cut to the tune of $536 billion by this Republican government. They get revenue from the Medicaid program, nearly $1 trillion cut by the Republicans in this government. Republicans are not here working today. And so they wonder whether or not they can keep critical services going in their hospital. Not every service is a cardiac surgery service that makes money, or other cardiology services, but services that people need, pediatric services, birthing services. They're not high-end, high-dollar services, and we have seen over time that hospitals will often jettison those and other less profitable product lines just to keep the doors open and just to keep people employed. That's what they were facing. I heard from a nursing home administrator wondering whether or not they'll be able to keep the doors open of the nursing home, because what do they rely on? Where are seniors getting their care? People who have challenges in health. They're getting those in nursing homes where they need 24/7 care. I've worked in nursing homes, so I've seen the conditions there, and certainly as a policymaker and as a health officer in my county, I have been involved in the nursing home issues in the nursing home. I understand what happens if now when a nursing home closes. I've seen it. How to get people housed. What do families do? Do I have to come home from work? Do I have to take over for that 24/7 care that was being provided by the nursing home? These are the challenges that people are facing all over the country, and it doesn't have to be. And it's being manufactured again by the Republican Party, who here is not at work. And what's even worse, and sadly, is they're not here at work because of the Epstein files. They know when Representative Grijalva comes in, one of the first acts as a congresswoman will be to go in and sign that discharge petition, and then we will pass it. We have a bipartisan majority that will allow us to get those Epstein files back, and that is the last thing these Republicans want to deal with. A couple of additional points, and I'll yield back. I think it's important for people to understand that these disastrous cuts engendered by this big, cruel bill impacts everybody in the economy. It's not just a question about Democrats shilling for the poor and the dispossessed, shilling for the hard-pressed middle class. If you have insurance and you use that insurance to go to a hospital or to go to a nursing home, and the revenues to those institutions are cut by these cruel cuts, those institutions will either go out of business, or now you don't have a place to go if you need a nursing home. You don't have a hospital that might be near for you so that you can get emergency care if you need it. And indeed, you might be out of a job if those institutions close. And if you look at the closures that are occurring across the country, here in rural parts of the country, up in the northern Midwest, that's Trump country. These are people that voted for him, and it's not surprising that I guess Marjorie Taylor Greene, whatever she does, she reads polls, and she certainly understands the plight of her own children who are seeing their health premiums go up by 50%. Now, in New Jersey, 450,000 people are going to be impacted, and right now get a benefit on the exchange with the premium tax credits. 450,000 people in New Jersey. Medicaid impacts about 350,000 people in New Jersey. We go out for renewal here on November 1st. And as we know, these premium tax credits are going to end at the end of the year if we don't act, and these Republicans are not here acting with us to preserve those cuts. The average yearly cost of an individual in the exchange in New Jersey is going to go up by $1,200. The average cost for a family of four in New Jersey now on the exchange will go up by over $4,000. And this is on top of the increased expenses that come to families because of these ridiculous tariffs and this mismanagement of the economy, and the largest shift of wealth from the working people of this country to the wealthiest people in the world. That's what they have brought to the American people. And this is right on the ground impacting regular folks, and it doesn't have to be. the Republicans get back in here and get to work, we can solve this crisis for the American people. And I want to take on one other thing, a couple other things. One, and I've already mentioned this, so I'll just repeat it. When a hospital closes, when a nursing home closes, they're often the largest employers in their jurisdictions, and people are out of work, and that drives down local economy. And I want to take on a lie, a Republican lie that is just part and parcel of the same. We heard from the vice president. We've heard from Republicans that there are undocumented people sort of gaming the system and getting benefits under the Medicare and Medicaid program. That is an out and out lie. Undocumented individuals are not eligible to benefit under Medicare or Medicaid. Now, if you have an emergency, if you end up at an emergency room, no matter what you are, I'm a physician, we reach out with a helping hand. We don't ask people what your status is if you show up at the hospital. We don't say, are you a citizen? We don't say, do you have insurance or not? We reach out with a helping hand and we get you taken care of. And Ronald Reagan passed a law that said, if you show up in the hospital, your hospital, we're going to make you whole if you provide emergency treatment. So I just want the American people to know that they're lying about this question of whether or not undocumented persons in this country have access to these important programs. They do not. And so I urge Speaker Johnson, I urge my colleagues to come to Washington, join us here, and get back to work for the American people. Let's stop the cuts, let's lower the costs, and let's preserve and protect American health care.
Thank you so much to our panelists, and appreciate all the perseverance on behalf of our colleagues who are determined to make sure that we get the stories out about how impacted our constituents are. Our last panelists will be Congresswoman Mary Gay Scanlon of Pennsylvania and Congresswoman Lizzie Fletcher of the great state of Texas. I am unclear. I think both the congresswomen have the same seniority, essentially elected in the same class. 6 weeks. Okay, well, I'll let you duke it out between you on who I call on, but Congresswoman Scanlon has been here for quite a while, so we'll start with you.
Thank you. Madam Chair, thank you so much. And thank you to all of our colleagues for convening this important hearing to help all of us and the American people understand what is at stake right now for Americans' health care. Across America, the Republican healthcare crisis is not an abstract policy debate. It's a daily reality for working families, for seniors, for small business owners who are being forced to choose between getting the medical care they need and paying for basic necessities like food or rent or childcare. In my own district, these challenges have been painfully real. The largest health system in my district recently went bankrupt, leaving a gaping hole in access to care for tens of thousands of my Delco constituents. Several other critical community health centers have been pushed to the brink of closure, fighting just to keep the lights on. And still other frontline hospitals and primary care centers are hanging by a thread. Institutions like these are lifelines. When an entire hospital system shuts down, families are left scrambling for care, and dedicated healthcare workers are left without jobs. But Republicans are pushing policies that would make this crisis even worse. When they passed their big ugly bill this summer, they prioritized giving trillions of dollars of tax cuts to their billionaire buddies while slashing Medicaid funding and refusing to extend the Affordable Care Act's enhanced premium tax credits that millions of Americans rely upon to afford healthcare coverage. In my district alone, 24,000 people are expected to lose their health care as a result. Without immediate action, premiums are going to skyrocket, making care even less affordable and pushing our remaining providers closer to collapse. If hospitals and clinics in my community could barely stay afloat before the big ugly bill slashed their Medicaid funding, how will they survive with rising unreimbursed healthcare costs? My constituents have been reaching out to share their experiences and concerns. Last week, a woman in her 60s called my office to report that she had recently received her ACA renewal notice, and her insurance costs would increase from $1,000 a month
to $1,800 a month. If the ACA credits aren't extended, she's not going to be able to afford everyday expenses plus healthcare. Another small business owner who I met in a dog park over the weekend told me that until passage of the Affordable Care Act, he'd frequently gone without health insurance because he couldn't afford it. But now he has a family and he's afraid that without the Affordable Care Act credits, he won't be able to afford the premiums, which will put his entire family at risk. Even our Republican colleague, Marjorie Taylor Greene, is speaking out in support of the ACA subsidies, sharing that her adult children, their insurance premiums are going to double in 2026 if Congress doesn't extend the ACA tax credits. And we know what happens when people lose their coverage. When people get sick, they don't get better by not seeing the doctor. They get worse. They delay treatment until it's catastrophic. They rack up medical debt and risk losing their homes. We know that over 100 million Americans now have serious medical debt. And yes, people will die if they can't get timely health care. Republicans control the House, they control the Senate, and they control the White House. But they have decided they would rather shut down the government than negotiate with Democrats to find a solution to the healthcare crisis they've created so that millions of Americans don't lose their health insurance. So I want to thank my colleagues for holding today's hearing and standing together to make sure that American families can get the health care they deserve. I yield back.
And bringing us in for a landing, Congresswoman Lizzie Fletcher, who by maybe 6 or 8 weeks is also a member of the class of 2018.
Well, thank you so much, Chairwoman Wasserman Schultz, and thanks to you and the committee for holding this hearing today and for giving us the opportunity to talk about what we are seeing at home in our districts. I am glad to be here with you and with one of my favorite classmates who so beautifully and articulately expressed the vision from her district, which I am hearing in my own district in Houston. And I know that many of our colleagues have raised their concerns today about the Republicans' failure to extend the enhanced premium tax credits. In my home state of Texas, the cuts to Medicaid and the refusal to renew the expiring healthcare tax credits will mean hugely increased healthcare costs for all Texans, for every single person in our state, as they will for people across the country. It is estimated right now that Texas will have the highest loss of coverage of any state in the United States. If these tax credits expire, people in my community, like communities across the country, could face higher health insurance premiums, loss of health insurance coverage, delayed care, increased uncompensated care in our hospitals, and so much more. And many of the people that I represent have wanted to let people in Washington know how disastrous this will be for our community and for people across the country. And they have been coming to Capitol Hill for months and months since we were debating the big ugly bill, talking about how disastrous these policies are. And so I want to make sure that you hear from them today. And many of the people that I have the privilege of representing work in the Texas Medical Center, which is the largest medical center in the world. It is home to some of the greatest minds in medical research and medical care. It employs more than 100,000 people. It has 10 million patient encounters every single year and a GDP of $25 billion. Last month, the Texas medical institutions gathered together, as well as the Greater Houston Partnership, which represents the business community in our 12-county region in Houston and Harris County. And the medical center institutions sent letters to me and to every member of our congressional delegation, Republican and Democrat alike, outlining their concerns about the impact of the expiration of the premium tax credits and what it will mean for our community. And I would love to introduce the entire letter into the record of the hearing. And
Without objection.
Terrific. I would love to give this letter and just to share with you one example that they gave here of many.
They said to every member of our delegation, the consequences of the tax credits expiring would be devastating. If Congress doesn't act, a Texas couple in their early 60s could see their annual premiums rise by more than $17,500, more than tripling their out-of-pocket costs and placing coverage out of reach. The affordability cliffs would lead to coverage losses, delayed care, worsening health outcomes for our patients. There'd be higher uncompensated care costs, overburdened emergency departments, and greater resource strain across our networks. And the Greater Houston Partnership, as I said, which represents the business community and leading institutions in our region, also sent a letter to our congressional delegation supporting extending the enhanced premium tax credits and pointing out that of the nearly 3.5 million residents in a variety of industries in our area, nearly 1/3 of those workers are able to remain healthy contributors to our economy because of their ability to access affordable healthcare coverage through enhanced premium tax credits. These tax credits have provided business owners and employees alike with much needed stability, empowering entrepreneurship and economic growth. And our partnership has asked us to make it a priority to extend these tax credits. What we know now is that the estimates are that more than 1 million Texans could lose their coverage without an extension of these credits. And in my district alone, it's estimated that 125,000 people will see their healthcare costs increase as a direct result of the failure to extend these credits. So it is critical that Texans and all Americans have access to affordable healthcare, and it is clear that the enhanced premium tax credits expiring will be devastating, not just for people in my district, not just for people in Texas, but for people all across the United States of America. There's so much at stake, and that's why it's so important that we're here. It's so important that our colleagues on the other side of the aisle return to Washington and work with us to address this crisis that we've heard from at home. Republicans and Democrats alike, voters and constituents are telling me that they want us to solve this problem. I'm glad that we as House Democrats are here working together to do that, and I thank you for the opportunity to share these stories with you today.
Thank you both so much for your feedback and input and advocacy on behalf of your constituents, and to all our colleagues who came today and our expert witnesses who we began this hearing with. We want to thank you all for showing up to work because that's a basic requirement that our constituents live every single day. It's a concept totally lost on our vacationing House Republican colleagues, however, and I want to thank you all for explaining how devastating this GOP healthcare crisis will be for the people that we represent. We hear their fears constantly in frantic phone calls that were detailed throughout this afternoon, emails, or just by walking down the grocery store aisle when we're doing our own food shopping. So thanks to all of my colleagues, and especially to our expert panelists from healthcare to small business and health policy experts for detailing this human toll. The stories that we heard of lost coverage and skyrocketing costs will have devastating real-life results. More delayed diagnoses, more costly healthcare access through our emergency rooms, more crushing medical debt, and tragically, too many lives needlessly lost. We know it's coming. Republicans already enacted the largest cut to Medicaid in American history, and all just to provide massive permanent tax breaks for their mega billionaire donors. And the breaking news from my state while we've been sitting here is that our deputy director of Medicaid just testified in front of our state legislature that Florida is set to lose $3.8 billion in Medicaid funds under the big ugly law. It is outrageous. Republicans refuse to extend the Affordable Care Act tax credits for middle-class Americans, and they are clearly more than willing to expand the mass suffering. Trump policies have already made life too expensive in America. Rent, utility, and food costs just keep climbing. Now Trump tariffs and a slumping job market are adding to everyone's anxiety. And yet by refusing to extend these Affordable Care Act tax credits, tens of millions of Americans across the country will see their premiums, copays, and deductibles shoot through the roof. And we heard colleagues tell real-life stories. We're not just saying that that's what's going to happen. We have the evidence, and we brought that forward today. Americans don't need that added pain. Every single poll tells us that. They don't need another mega bill for the mega rich.
So Republicans need to end their paid vacation, and they need to sit down with Democrats to negotiate a spending deal that prevents this healthcare crisis from exploding and one that reopens our government. Notices of healthcare price hikes are going out to Americans right now. My constituents share them with me. They can go to my Facebook page. I posted one of those notices today. Even, as you heard, Marjorie Taylor Greene broke ranks and urged her Republican bosses to negotiate a solution to this crisis. And until that happens, House Democrats will continue to show up and do the work to cancel the cuts, lower costs, and save Americans' health care. Thank you all again. Democrats will keep working to solve this healthcare crisis that was manufactured